Hello. Hey, you're muted.
Hello.
Oh, there you are.
Are you in San Francisco?
I just got fed up of clients seeing my personal space.
Yeah, no, that's fair enough.
It felt really intrusive.
We can put those on WebEx, but it really reduces the capacity of the video. Yours seems really good though.
Is WebEx the IAPTUS one, like the inbuilt?
No.
Oh no, okay, because IAPTUS have their own version, but you got to pay extra.
Oh, do you? What do you use at your service?
Zoom or
What
Teams.
do you?
It's personal choice, but I prefer Zoom. I think it's just a bit easier for me to use. I'm not a fan of Teams.
Yeah.
As well. Yeah, so I just had my uni today on OCD. Was really interesting.
Oh, was it good?
Yeah, and I got an email from my supervisor. They've dropped our caseload. KCL asked for a caseload update from all the students, and I gave mine, and then they were like, "Jason, 10's a bit much." For
Really? Oh,
training."
I've got 10. Ugh.
Really?
Yeah, we have to hold 10.
Oh
Which is
no.
so annoying because my colleagues that work in perinatal, they hardly ever get DNAs. So their service is happy for them to work off the figures of them only holding 5 on their caseload.
No, that's frustrating. Yeah, we were 10, and then I think KCL were concerned, and then they spoke to our service, and so my manager emailed saying, spoke to KCL, we think 8 is a much better number.
Sweet, that gives you extra time. Nice.
Yeah, I've got 9, but I'm hoping to move one off. So, as well, only 3 people so far. So,
who have what joined up to this?
Yes, only 3 people who are in the waiting room, but it's still early.
Yeah.
As well. What I thought we could do is obviously talk a little bit about ourselves, like what service we're in.
Yeah.
Like which uni. Maybe talk a little bit about, just how we're finding it.
Yeah.
And I guess from there, what do you think would make sense to go? Like talking about the application, interview.
How do you take questions? Do you take questions as you go along?
Yeah, as we go along, and then just
Yeah.
mostly at the end. And if someone asks a question about the KSA, I might say, "Oh, we are going to talk about that," so we'll get back to that.
Yeah, okie doke.
Because what I don't want is, what can happen is someone might ask a question like you're talking about your experience. They bring a question about a KSA, you answer it, and then it changes the topic to the KSA because more people.
Okay, you can be in charge of that then. I think that's really important. That's why I was saying, because I think it's helpful that people can ask questions as you go along, but also you run that risk, don't you, of it just completely sabotaging.
And we've got 5 so far. We've got 5 people waiting, so it's going up. And I hope we can keep this to an hour.
Yeah.
At most, because I'm hungry. I've not eaten.
Yeah, I'm hungry. My sister's cooking me dinner for 7.
I can
so
smell
that'd be good.
food. I was cooking.
Are your grandparents still there?
Yeah.
Oh, nice.
We're cooking like homemade burgers, and I can smell it.
Oh, that's just made my mouth actually water.
You've got all the proper trimmings, like the nice cheddar cheese, the gherkin.
Oh, can you stop, please?
I know,
Otherwise, I'm going to go right now.
I'm looking at my digestives. I've got a packet, and I was like, should I just nibble on those now and ruin my appetite?
Oh, I'm going to have a snack. I'm going to have to go get an apple.
Yeah. This wasn't the best time. I don't know why you insisted on 6 o'clock.
I only had soup for dinner. It never really hits the spot.
No, it doesn't. Cereal's the same. I don't know why you insisted on 6.
Did I say 6?
No, I did. But
I thought you said I was going to be at 1. I think people can get quite scared about the KSA. Yeah, I think like loads of reassurance about that, and I think people kind of want you to tell them how to do it.
Yeah, and I'm happy to give that, but I thought KSA could be at the end because the people who don't need a KSA, if there's anyone, can just leave at that point.
Yeah, good idea.
Because I think, yeah, if you're someone who's got a core professional, I don't need it. It's probably going to be a bit annoying if KSAs dominate. So I'll probably just start by saying we will talk about the KSA. That's going to be the last thing for those reasons. So if you have questions about that, I'd probably wait until the end.
Yeah, good idea.
As well.
I think it's really good to raise the point as well that every uni and every county really does have a different application process.
They do, very much. KCL was probably the most different to anyone else.
Yeah, and I feel like Birmingham has like a really relaxed route. Like the Midlands are so weird in that you apply to the uni and the job separate.
I tell you what, I really got a good feeling from Birmingham. I don't know why. I just enjoyed the interview. I really liked that he did like a little presentation.
They're so relaxed. Like they do everything they can to help you pass. Like I love it.
Yeah, so I felt like it was really quite nice. I got a good feeling from it. I got a good feeling from a lot of them, except Newcastle. That's probably the only one I wasn't keen on. But a lot of them I was quite like, yeah, actually these are all potentially good places. Hertfordshire, I liked the service, but the idea of only going uni once a week, I was a bit like, no, that's too little. So I was like, yeah, already it's a rushed course. Sussex I liked the sound of, but they were very different.
Have you well, yeah, I think it just goes to show though as well. Like I applied to like 12 or something like you, and I only got one interview at one place. So I do think it's really important that like you do have IAPT experience, and if you don't, you really plan where you're going to apply.
Yeah, and I think that's where you'll be quite really helpful because you come from a very much outside route. Like you know, and I think from that you know what's some of the key things to mention. I mean, I'd say it's not too surprising with KCL because I'd say 80-90% of my course are PWPs. We're majority of us, and there's 60 of us. I'd say there's maybe.
I would say on my course, out of 28 of us, maybe 6 were PWPs.
Okay, it's nice that they value other experiences, but KCL seems to really value PWP. Oh, we got 14.
How many did you have last time?
I'd say about 20.
What was that for? The same, just to discuss the same thing?
It's PWP, that was.
Oh, PWP.
Yeah, I've not done a high intensity before. I felt I'd give it a bit of time before I actually act like I know it all. As well. And I think it's really important to be honest about, what's going well, what are the challenges. Because I've found this really challenging, this course myself. I mean, from yesterday.
Yeah, look at the state of me. Like, I'm really struggling with the whole, like, I really avoid reading because I find it really hard.
Yeah, same.
Every day I'll say I'll get up and I'll read an hour before my first patient, and I never do. And I end up getting out of bed like 10 minutes before my first session. Like, I don't put makeup on, I don't get dressed. And I think that is just because of how the course is making me feel.
Message the waiting room.
Feel swamped.
Yeah, I'm the same. Like when my supervisor's saying I recommend reading this, I'm like, I'm not going to do that because I don't. Reading is not my style. I really struggle with that. Oh, 18.
Oh, wow.
20. 21. It's really.
They are rolling in.
22. Okay. We'll wait till 6 on the dot. But then what I'll do is I'll close the waiting room so people just let themselves in and out. I don't have to keep checking that.
Yeah.
As well as anything you're not sure about. I mean, honestly, it's very easy going.
I just like it that there's a forum for people to be able to come and ask questions, to be honest.
Yeah, exactly. I had a lot of people from work, and I think you had me to an extent. I passed everything I learned from other people onto you. Definitely,
and I think without that guidance, it's very hard. Like, I know, like you always say, oh, it was your hard work that got you on the course, but without your support, I don't think I'd be sat here.
I think the thing I did was push you to it.
Yeah.
Try, and I was so glad. Like you couldn't believe how happy I was when you.
Oh, bless you. No, and I think we're probably and I think we'll just do that throughout all of our career, won't we?
Yeah.
But no, I really value that guidance because I don't think there's a lot out there, and I think it's really important.
Absolutely. Well, it's 6. Should we let them in?
I'll put my apple down.
Do you want to take another bite?
No, it's all gone.
few people still joining and connecting. Hey, okay, I think everyone's in. Can everyone hear okay? I can just get a thumbs up. Great, thank you. Hi everyone. Now I'm going to be one of those sticklers. If you can have your camera on, I'd really appreciate it. You don't know how off-putting it is when you're talking to nothing but names. So if you're in a position where you can have your camera on, I'd really appreciate that as well. Thank you. If you're not, because of bandwidth or other things, I get it. But anyone who can, I really do appreciate that as well. Okay, I think. Yeah, that's fine, Anne. I understand. Okay, so we'll start by just introducing ourselves. So obviously, I'm Jason. I'm one of the trainee CBT therapists at the moment with King's College. And I've got my good friend here, Ella, and I'll let Ella introduce herself.
Hello everyone, I'm Ella. I'm a current trainee at Birmingham University with a placement in Herefordshire and Worcestershire IAPT.
Yeah, and I'm in the Bromley IAPT. And so I'm hoping this is all going to be done by 6. Ella's just finished work. I just finished uni. We've not had dinner. So
oh, 7 you mean, Jason?
Yeah, 7, sorry. You can tell
Focus getting to you.
I've been on these all day since 9:30. So I'm hoping today will just be about an hour, and it's going to be quite free flowing. It's going to be quite open to questions. The main things I think we'll want to cover today is just talking a little bit about, how our experiences with the course, what's going well, some of the challenges, talk a little bit about the role of high intensity therapists, then talk a little bit about the interview process and application process. So I'm sure there'll be a lot of questions around that. And then there'll be kind of a moment to just talk more generally, but then towards the end, and I'm going to save this to the end, talking about the KSA. The reason we're going to save the KSA to the end is because there might be people here who have a core profession and don't need to do the KSA. So at that point, they can leave because they won't need to waste their time listening to that. But I get the sense that's going to be a big topic tonight. So if you do have a question about the KSA, that will be covered. If you could save that to the end, that would be really helpful as well. So Ella, I'll let you kind of start and talk a little bit about, how things are going on your end.
Okay, yeah, so we are currently, so the course started in September. So, I think a lot of people in this group were probably looking at career options. So for myself and Jason, we have been kind of previous doctorate applicants. And I was really fortunate to be opened up to this pathway by Jason, who worked in an IAPT service. So it might be helpful just to kind of say that I haven't come from a traditional route. My experience is delivering CBT in prisons and then working as an assistant psychologist in the private sector. So I guess just to dispel some of those myths that you kind of have to have lots of experience, you have to have worked in IAPT before. It's not necessarily the case. So just to give anybody from an AP background a little bit of hope there. So in terms of the course, yeah, probably about 4 months in, really enjoying it. I think, the most important thing to ask yourself as practitioners is, what do I enjoy about my role? And if it is that you like that one-to-one therapy, then I would recommend that this is definitely the course for you. So I'm not sure if people are familiar kind of with the setup of how the program works. So what happens is you have 2 days at university and 3 days in placement with a caseload of between 8 and 10. So yeah, at the minute we're kind of getting taught 2 days a week and then implementing that into practice 3 days a week. Really enjoying the role. It is very kind of fast paced. You take on a lot of responsibility and it can be quite tiring. However, I don't think that it's unmanageable for people, if people have got families or lots of kind of social commitments. I'm definitely a social butterfly. I think it is doable if you're very organised. I think a lot of people say, these courses are hard work, which they are, but I think, I just want to reassure you that you can achieve that balance. And, it is a really you know, I see this as a really valuable career option. You know, you train at band 6, you qualify at band 7. It's a very privileged position to be in, with all kind of your CBT qualifications funded by NHS England. So yeah, I'm really enjoying it. I'm currently in an IAP service. So yeah, is there anything else that you think would be important, Jason? Oh, you're muted.
Yeah, sorry. I'll say my bit, and then actually it might be good to talk a little bit about IAPT, especially as someone who's not had experience with IAPT before, because that's a very different place to most.
Yeah, and I don't feel I'm best placed to comment on that. I'm only 4 months in, first time in the NHS, first time in IAPT. So.
But I would really echo a lot of what Ella just said about everything. So very similar to me with King's, I'm on placement 3 days a week, where I'm having one-to-one CBT sessions with clients, and then at university Thursdays and Fridays as well. I think I found that my service, the course, have been incredibly supportive, especially with the pandemic and lockdown. Both me and Ella kind of are learning remotely at the moment, which isn't really the best way to be doing this training. So I mean, hopefully if anyone does get on for the next intake, you'll have the opportunity to go in person. But they've been incredibly supportive, very easygoing with all their assignments. They've pretty much said if you need an extra 4 weeks to submit things, that's absolutely fine as well. Yeah, I can see someone's raised their hand. Iris?
Hi, is it good time to ask a few questions?
Yeah, if people have questions, absolutely, we'll kind of stop and answer. If there's a question that we'll cover later, then I'll make a mental note and we'll definitely cover that. But yeah, okay. Fire away.
Well, basically, I've got health conditions. I'm training as a health psychologist at the moment, which doesn't include therapeutic training. I'm just wondering, has your experience been, do you have to have like a placement? Would you be able to choose a placement? For example, the clinic I'm working in now hasn't got a psychologist. If I negotiate that, it's also at King's actually, with the clinic and with the department, is that something that might be able, after my PhD, I'd be able to go negotiate, say, look, can I work here 3 days a week? And would you say it's physically quite full on? Because I'm very well adapted to working from home, but after COVID, hopefully, well, for your sake, it will all go back to face, but for my sake, it will be a lot more difficult. Do you think there's flexibility in that?
Yeah, so to answer your first question about kind of placement, so the way it works with the PWP training, the high intensity training, is it's very different to learning privately. So if you were to do training CBT privately at, say, Oxford, then you would have to kind of find your own placement. The way with IAPT is you're not so much a placement student, you are actually an employee. So when you apply through the high intensity, you are applying through the service, and the service are very much funding you, and then they're sending you to university. So when Ella and I were applying, most of the applications are through NHS jobs. So it would be like, Hereford have an application in this particular service for trainee CBT therapist, apply, interview, okay, you're going to work with us 3 days a week, 2 days a week, we're sending you to Birmingham Uni. So it's different to, I'm going to apply through the uni and find my own service. It's actually the other way around. You apply in the service and they send you to the uni.
So if you wanted to do your own placement in that way, you would probably not be funded by NHS England. So I wanted to do it through my own psychology. I work for a private practice part-time as well, not for my friends. And if I wanted to train with them, then I would have had to pay the £10,000 training fees. So when you apply for this role, you get funded by IAPT to do the CBT course. So if you're looking to kind of remain where you are in the private sector or to set up your own kind of placement, then you might not be able to get the funding, because it kind of comes part and parcel. They come hand in hand.
Yeah, so basically they've got a need for a therapist, so they train you up to do that role rather than creating your own sort of, even if it's within the same service. But
generally my experience is 99% of placements are in IAPT, and on my course we've got a handful of from a perinatal service.
And King's is very much all IAPT. King's process is slightly different in that instead of applying through NHS jobs, you apply through their King's website and you just make it clear which service you'd like to apply for. So you'd put my first choice is this service.
Okay, so that's interesting because I'm doing my PhD at the IOPPN at the King's, but I also work as a honorary assistant psychologist with SLAM. So maybe if I talk to SLAM, maybe.
Yeah, and so SLAM, you could look at Lucium, forgetting all of them, and I should know because I'm in the SLAM area.
Perinatal service as well, so
yeah. So that's the King's process. It's all slightly different, but we'll definitely cover that a bit more. And you had another question about kind of support. The fact is, I think there is very much going to be a drive going forward that IAPT will be very much a remote job, because what the stats are showing is that actually IAPT has adapted probably the best of all mental health services to remote working.
Wow.
And they're very much likely to keep that. Attendance rate is a lot higher than it was previously. And staff well-being and so on. So I think you probably be quite safe in that remote is going to be a big part of it, and going into a service will be more optional, is what I think the discussion is.
That sounds really encouraging. Thank you so much for answering these questions.
And so with the training itself, I mean, I would say it's been incredibly an enjoyable time. I am learning a lot. It's very fast-paced, as Ella said. It's probably been the most stressful time as well. I will admit, yesterday I had to have a mini moan at Ella how de-skilled I was feeling, and I'll let Ella add on to that as well.
Yeah, I think it's really tough because what you have to accept is that you're not going on to the course as a qualified CBT therapist, you're going on to it as a trainee. So, you know, what quite often happens is you're being allocated OCD patients or specific phobia patients before you've even received the teaching on it. So initially it feels like you're chasing your tail to kind of look at the models and treatment pathways without the teaching, and you kind of do it and you learn through kind of doing and making mistakes, and then kind of when the teaching comes, the light bulb clicks. But unfortunately, some of that teaching you're not going to be getting until like a whole 12 months after or a whole 10 months after. So I guess it's sitting in that place where, you know, you are recognizing I am a trainee, I haven't got all the skills, which can be quite difficult because I guess the nature of IAPT is, you know, you're receiving patients, you know, where else other than secondary care do people with mental health go and mental health issues go? And, you know, it's quite hard to meet the threshold for secondary care. So IAPT's doors are basically open to anyone and everyone. We say common mental health issues, but you are dealing, you know, in some cases with some very complex cases and complex risk and trauma. So, you know, you can feel, as Jason kind of said there, you know, de-skilled and a bit overwhelmed at times. But I think in your first, you know, your training, you do get 2 hours of supervision a week, like 1 hour at your placement and 1 hour at your university. And, you know, peer support is amazing, you know, particularly from my colleagues. So there is definitely lots of support to manage that and to vent about that. And I, you know, my relationship with Jason is, you know, I've never met him, but that to have that support of a colleague, you know, at the other side of the country is so invaluable. I would really recommend kind of getting, you know, names of each other and supporting each other through this process to like share ideas, to vent, you know, between. I find that's been really helpful to cope with that.
Yeah, and like Ella said, you do get support. You get an hour's supervision at least from your service supervisor, and then you should be given 90 minutes group supervision through the university as well. So there is quite a lot of supervisory support. So they'll give you an idea of what you'll be doing. It's not a case of, I have no idea what I'm doing this week. They'll let you know what you're doing, and they'll kind of guide you to actually where can I get this information to kind of get the full details with it. Just seeing if we've got a nice question from Anne. Are clients informed about the fact that you're a trainee? Not criticize, yeah, that's fine. Definitely not seeing that as a criticism. But yeah, so yeah, you would obviously want to be quite honest, you know, when you're calling clients, you know, I'd always introduce myself as a trainee CBT therapist. To be honest, up until now, I mean, I was a trainee PWP. It's very rare for a client to have concerns about you being a trainee. I think for the most part, they're quite happy. If anyone has been concerned, I've always found it to be quite honest and just check that concern with them, because actually what the data shows is that trainees get better recovery rates than qualified, and that's because as a trainee you're given the most up-to-date evidence for the treatment, and you are being much more closely supervised than a qualified. So in that sense, you tend to do better than a qualified who might have been doing this for like 5-10 years and is at that point where they feel they know it all and they don't need to get closely supervised for it. When I have had people comment about me being a trainee, I've made it clear to them that I'm not a trainee like an undergraduate student. I am an experienced practitioner. I'm just specialising this into CBT. And I'd say up until now, it's been 100% fine. They've not had any concerns with me as well. Everyone's experience might be different, and you might get a couple of people who are concerned, but for me, it's been fine. I don't know if Ella, you've had any.
So everybody I've contacted has been okay to work with me apart from 2 patients. And it's just one of those things, it's an individual's choice. Like you said, you just be kind of open and honest about that, and respect their decision, especially if somebody's come in with a really complex issue. They might not feel that a trainee has the skills in their eyes, and that's okay if they share that belief. At the end of the day, I guess our end goal is to support these people to recovery, and we need to do everything we can to give them best faith in the service. So if that's kind of their, if that's what they feel is going to be right for them, then obviously their recovery and their mental health journey is what it lies at the center of this. So yeah, it's not something I get too caught up in. I kind of, before I even book them in, I'm having that conversation. I can just see a few more coming in, Jason. Questions around difference between step 2 PWP and HI. You're probably best placed to answer that, but I will say I delivered CBT for 5 years before I did the CBT practitioner's course, and it's day and night different. Like, I thought I knew CBT. This is like, wow. it's insane. And so I'll let you answer that one, Jason.
There's nothing in the world to prepare you for how different the roles are between a PWP and high intensity practitioner. I would say it's very much in how you do the session. So as a PWP, you're very much limited to 30 minutes. And the full role of a PWP is providing psychoeducation. You're telling people these techniques. So when you're working depression, you're telling them that the evidence shows that improving our activity levels between pleasurable routine necessary is the quickest way to improve our symptoms of depression. So you're giving them that information, and you're giving them very much homework around that. In high intensity, it's all about guided discovery. I'm not telling my client the answers. I'm leading them to draw their own answers. So, for example, here's a real stark contrast. In step 2, when you're working with panic, one of the first things you tell people with panic is panic attacks are not dangerous. They do not kill you. At step 3, I don't know if panic attacks are dangerous. Why don't we test that out? Very much different. It's about them drawing their own conclusions. It's about the guided discovery. You help them discover these things for themselves, and I've really enjoyed that, because when you see that light bulb moment, it's such a powerful thing, and that really sticks with them as well. So that, I'd say, is one of the biggest difference. And also it's the pacing. One of the things they've really emphasized on KCL is, for your sessions, you get an hour to 90 minutes, is focus on doing one good thing a session. So as a PWP, your first session could very much be introduction, attendance policy, 5 areas, problem statement summary, SMART goals, and God knows what else. In step 3, I have a whole session, an hour on a formulation, and that's it. And the key message they have is, do not give them homework that you've not done in session. So you wouldn't expect someone to just keep a diary of their activity levels without having done that together in session. So those are some of the key differences between those as well. Looking what else? So someone's been shortlisted. Congratulations, Stella. I was asked to state my preferred service, which were in different areas, Brighton, London. I guess my first question is, would the university assign for?
I think there was one before that, Jason. So as you're considering it, I'll just grab it. So at step 2 PWP, we receive clinical skills every fortnight in service.
Okay, so that, yeah.
It's all right. So every service is going to be different. So if your clinical lead at the service thinks, that's something they want to put in place, then the service might. Mine don't. So I receive an hour's supervision in a mini group on a for 1 hour a week, and then I receive one-to-one supervision with my supervisor. So I get 2 hours per week. I don't know what it's like for you, Jason, but we don't have any clinical skills sessions.
No, first of all, hi Diljet. I used to supervise her back when I was a senior PWP. Yeah, so I can tell you with Bromley, Diljet, we don't have clinical skills as trainees, but you can attend a qualified one if you want.
Yeah.
As well. So I've been, sorry, I'm still trying to get my head around Feather's question. So, by the service, be local to the service you are working. Yes, very much. So it would be area to area. So if you're going to Brighton Uni, then the service would be in that area as well. Please do speak out if I've misunderstood that. Are there many health?
Yeah, I agree with that, Jason. So like when you apply via NHS jobs, it will clearly state, you know, so obviously NHS jobs will state where the job is. So say if the job is available in Birmingham, it will say as part of this, you will also need to have passed the assessment process for this university. And you know that, so geographically they are all tied together. But just something to mention is every kind of geographical area, to make it confusing, has a different application process. So like what Jason said, King's you apply through the website on their university. I would say 90% of them you apply via NHS jobs, and that is a combined application with the university. Is that correct, Jason?
Yeah, pretty much.
Yeah. And then the Midlands, which is a Birmingham, Coventry and Warwick, and Staffordshire University, you have to apply separately to the job on NHS jobs and separately to the university. So the Midlands is a little bit more tough because you have to pass 2 lots of interviews, 2 lots of, you know, one with the university and one with the placement itself. So just bear in mind that you need to swat up on where you're applying, what their application process is.
Yeah, very much. Iris, could you elaborate on your question? Are there any or many health psychology service placements in general?
Yeah, I just wondered if there's placements within like health psychology services like cancer or renal or anything like that, or is it more sort of mental health focused, like anxiety, depression, that sort of thing?
Yeah, I would, yeah, very much so the latter. I don't know if Edda's experience is different.
Yeah, latter.
IAPT is having a big push towards long-term conditions. So when you qualify, there is a big push to working with chronic pain, chronic fatigue, diabetes, all sorts. So, you know, I'd say any experience you have with long-term conditions will be extremely valuable, especially for any IAPT setting.
Yeah, we've just hooked up right now. Yeah, we've just hooked up with a diabetes service in Hereford.
Because my PhD is in long-term conditions, so.
Yeah, so you would have, that'd be really relevant to them, and they'd probably find that quite interesting and useful.
Okay.
Okay, I'm a PWP, and I hear a lot that high trainees say that you have to. Yeah. Okay, so I can say there is a lot of valuable things that you bring as a PWP. You know, your familiarity with CBT, your familiarity with IAPT. The 2 things I say it comes down to is people who come from a different background, so like OTs, the things they need to learn is how to speed up in their sessions. The thing a PWP needs to learn is how to slow down. PWPs are very good at covering a lot in a very short amount of time. And one of the most challenging things I've personally had as a PWP is to not be so didactic. Because as a high intensity, they like their open questions. They want to see Socratic questioning. And as a PWP, you very much get into the idea of giving the information. They try and encourage to be Socratic, but it's not really feasible with the time you have. So it's a big habit you develop as a PWP is to be quite didactic. And a common question you will be asked, and I'll let you guys know now, is one of the challenges you expect to face in the course. They will love that answer if you tell them that as a PWP, you know, one of the things I'll need to learn is to be more Socratic. It got me gold points every time. So there's a freebie there.
Jason, I'm just wondering, was there a question from Naya? Did we answer that one? I'm going to apply to be.
Oh, okay.
Do you want me to grab that one?
So this, I think, comes to the KSA. So
yeah, I think you're right.
That will definitely be covered.
But from my experience, PWP and training, how to get, okay, yeah, so it is through the completion of the KSA, which we'll discuss towards the end. I think probably at this point with that question, it's probably good to outline the kind of 3 ways you can get onto the course. So if you're a PWP, you can apply after how many years of practice and qualification is it, Jason?
So so you got to be qualified 2 years as a PWP.
Okay, so what I would say is, in my experience, I applied to 12 universities. I got shortlisted at 1 and interviewed at 1 and got a place on 1, and that was Birmingham. So I think, again, looking at your experiences and looking at what the universities you apply to value is really important. So, for example, on the Birmingham course, I would say there's 5 previous PWPs out of a cohort of 28, but on Jason's, you reckon about 90% of your cohort are PWPs.
I'd say
so if you're not from a PWP background, I would really kind of recommend looking more kind of Midlands based. I know for a fact that Coventry, Warwick, Birmingham and Stafford are really open to different avenues of experience. The second route is obviously through the core profession. So if you're a core profession like an occupational therapist, psychologist already, obviously you can just apply to the course and you don't need to do the competencies. And anybody else kind of who doesn't have a core profession, who hasn't been a PWP, again, you know, you have to complete that KSA, which Jason said we'll come back to in a bit.
Yeah.
And that's the competencies to show how your experience kind of leads to the point where you're ready to train at this level.
Yeah. And got a good question from Hannah, and I know the pain all too well of the high targets and caseloads as a PWP. Absolutely not. So it's not going to be anywhere near that, because for one, your contacts are an hour, whereas treatments for PWPs is half an hour. Caseload will vary service to service. In my service, we're about 8 or 9 a week, and I think Ella's is about 10. So it will vary, but it won't be like the 20-30s that you would be familiar with as a PWP.
Yeah, you get a lot of protected time in that training role.
Yeah. So I've got a good question about the agenda setting. So did you say just do one item? How does that work if client brings own item, not necessarily connected to goals? That's a really good question. And one of the things about CBT, especially at step 3, is the overall goal is for you to become redundant by the end of therapy. It's very much patient-led. It's going to be a collaborative process. One of the first things you want to ask people is, I'm wondering, what have you brought today for today's session? And it could be a number of things. So it could be, oh, I've really struggled with this. And you can make an agreement to cover that at the end. And then I'll just say, okay, that sounds good. I think it'd be quite helpful if we do a bit of this today as well. Shall we do this bit first and then we can dedicate time at the end? And that's pretty much how it is. Whereas a PWP, I remember agenda setting was, you know, today I want to cover 5 different things. In step 3, it's very much not like that. There is room for the clients to really push forward. And when you start getting further along in treatment, you want it to be more client driven. So when you're doing things like behavior experiments, when they get used to it, you'll ask them what's going to be useful to do today. And that's very much the case, because the goal is by the end of therapy, they don't need you anymore as well. So very much you want to think who's in the driver's seat at each point. Do you know anyone that has got onto the course without a PWP or AP experience? Ella, are you considered one?
So core professions would be, so like I know people who've been social workers, occupational therapists, probation officers. The problem is, if you haven't got a core profession and you don't have PWP or AP experience, the role would have to be very clinically focused. So as long as you've received clinical supervision and you can evidence that you've put a psychological theory into practice. So it depends what the roles are. Like the competency portfolio, which I'd point everybody towards on the BABCP website, which we'll discuss later, kind of highlights the competencies. So it would have had to have been a job role in which you could have achieved those. I know supervision is a definite one.
Yeah, definitely.
And implementing a kind of a minimum of 4 psychological theories.
Yeah. Might not even be for like in depth, but having an awareness of those 4 theories. And I think KSA 4 is going to be a massive area of discussion for the PWPs later on, which is about the psychological theories. Got a question here. Can you work in CYP IAP? So for people who don't know, that's children's young person IAP after doing high, or do you have to do a separate CYP IAP training? So just to say, absolutely you can. This is something I think, Ella, you had trouble getting your head around that first, which is
I'm still really nervous. I didn't want to answer this because my background's children and I've swapped to an adults IAP course and it still gives me like, oh.
You absolutely can. You are coming out a fully qualified CBT therapist. I know just to highlight the variety. I know a person who trained at KCL, and literally as soon as she qualified, she got a job at the Maudsley Inpatients Eating Disorder Service. I know someone who's working in the PQ. I know someone who's working at the Priory Eating Disorders CAM service. There is no difference. If you are a CBT therapist at the end of the day.
They do special children's and young people's courses, you know,
yeah,
but they're very far and few between. So, you know, I think it's a case of watch this space. So I met a clinical psychologist on training last week, and she said to me, you know, at the minute, we can't employ CBT practitioners to kind of psychologist roles or children's roles in certain NHS trusts. But she pretty much said, watch this space because it's coming. And actually, it's really nice and empowering to see this profession and practitioners being valued just as much as kind of clinical psychologists. And kind of, I think it's a case of, yeah, there's going to be plenty more opportunities coming up, but I think we need to give that about 18 months.
So question back from Joel. I'd imagine each service is different, but can I ask if you are seeing clients face-to-face or currently over the phone, such as PWPs? You can see clients over the phone. It's mostly video cameras at the moment. I would not recommend doing this over the phone because it's a very collaborative type of therapy and it's very visual. You know, when you're drawing out the formulation, you want them to see it as you're drawing it out. It's going to be impossible to do that over the phone. And also, I think, for example, social anxiety, you absolutely could not do that over the phone because one of the key interventions with social anxiety is to do a stooge experiment where you have them speak to a stranger for 5 minutes and practice dropping their safety behaviors, and you can't do that over the phone. So all my clients have been over Zoom. I don't know if yours is different, Ella.
Exactly the same, unless there's clients with any additional needs. So if somebody was deaf or blind, then we would make that exception. But as Jason said, our recovery rates have actually gone up on this kind of virtual basis. So they're kind of probably looking to keep that in place. And definitely, I always encourage my patients to use video call. It's very difficult over the phone.
Yeah. Megan, we will definitely talk about the KSA process. Absolutely. Stella got a question about KSA again. So in terms of when the KSAs need to be completed by, it depends on the universities. Surrey are quite harsh. They wanted all of the KSAs sent before the interview. KCL wanted 2 of them. Birmingham didn't want any.
Yeah, and I was very passive in this, so that really met kind of who I am. You know, I said to Jason, I'm not going to really write my KSA until I know I'm successful, because, you know, it's a very, very, very big piece of work. So Birmingham, fortunately, it wasn't due until a month after you've been accepted onto the course and you'd started the course. And I've actually got colleagues that still haven't submitted their KSA. So again, you know, what things work for you as an individual? Is that flexibility something you like?
Yeah.
Consider where you're going to apply.
Yeah. This question, Sarah, I'm not going to lie, I don't know. If you did a year of PWP and a year of AP, would this be okay, or would they still be looking for 2 years as a PWP? I don't know how strict they are on this rule. I was told by my manager that services outside of London might be more flexible, but I don't know. That's hearsay. I do know that they do say they want 2 years full-time experience, but I've got a friend who was a PWP part-time the minute she qualified and had an interview with KCL and got a place with Sussex. So the full-time thing obviously didn't matter. there. So I'm not sure, but I'd say there's no harm in trying and seeing what happens. So as a qualified CBT therapist, how many clinical contacts would you expect to have per week? That again varies very much service to service. In my service, it's about 20 hours, which is about 20 clients, but then that's obviously things you do like supervision, clinical skills, groups will obviously take that away a bit, but it varies service to service, I'm afraid. But I'd say 20 is the average, I would imagine.
Ours is 20 completed sessions, and we have to overbook to make sure we meet that target. So we're booking 24. So
No,
that's quite tough. Yeah, it really depends on where you work. Jason, there was a question around kind of when do they run interviews and when does the course start? So there's 2 yearly intakes. So one is you apply kind of February, June to start in September. And then I think, is it applications around September to start in January?
Yeah,
I didn't do that intake. Yeah, roughly so,
that. Just to make it clear, KCL only have 1 intake a year, but Royal Holloway, which is the other London service, will have 2.
Yeah, and some Midlands ones, so Birmingham intake for September and Coventry and Warwick and Stafford intake for January. So again, it's about kind of looking where you want to apply and finding that information out. Obviously me and Jason can advise on our services, but I can't stress how different it is for every service.
Yeah. I've got a question. If you're a PWP for 2 years, do you have to do the KSAs? Unfortunately, yes, because unfortunately PWP doesn't count as a core profession. The only way you're getting out of it is if you've got a core profession, which is occupational therapist, clinical health psychologist, I think would come under that, having a doctorate essentially, being a nurse, those sort of things count as a core profession. So you need a core profession to not have to do the KSA. The KSA is not as bad as you might think it is, and we'll talk a little bit about that as well. Have I missed any questions, Ella?
No, I think the next one down is about as a PWP we'll have to wait 3 years before apply. I don't know if that one's kind of been answered, but most services are quite strict on that 1 year training, 2 year post qualification before application, aren't they?
The course lead Suzanne from my uni was explaining it, and it's something to do with the BAVCP, which as a trainee you have to register for, and they need like a 4-year qualification or something, and I think your 1-2 years counts as 3, and then 1 year of training makes it 4. I'm speaking rubbish. I wasn't paying attention that much, but it's something like that. There was a reason for it.
Yeah, the course, and then what hours and days do you work? Generally, it's Monday to Friday, 9 till 5, with some flexibility depending on your service, but it is a full-time course. So you have to be able to commit to the 5 days a week, 2 days at university and 3 days in placement. They are particularly strict at Birmingham. You have to have 100% attendance at university to qualify. If you miss a day because of sickness, you will have to watch the lecture back and write reflective analysis on what you've learned. But generally, you can't just pop off on holiday. So, for that year, you have to be prepared that you're only having time off in children's or what would be kind of regular school holidays.
Yeah. So seeing some questions, and I think we covered them. So we've got a question by Roberta about when is the best time to apply for the training? Do they have intakes at set times of the year, or is it different for each service? It's based on the university, not the service. So all London services will base it around Royal Holloway and King's, and I imagine Birmingham's very much the same. Yes, Ella?
Yeah, sorry, I was reading a message.
Yeah, you got a question directed to you.
So from Sai then, okay, applying to posts in different geographical areas, do you recommend putting your eggs in different baskets? Okay, so I was lucky enough to have Jason pushing me along, and I actually applied to 12 different services reluctantly, because without the PWP experience, it did really knock my confidence. I'm really willing to put my hands up and say that. I felt underqualified. I didn't feel that this course was placed for somebody like me. And what I found through, I actually rang the Birmingham course lead to have a discussion with him about my experience and if he thought that my experience would be valuable on his course. And he gave me all the reassurance I needed, really. And in terms of putting your eggs in different baskets, like, this is really good with this course, because if you get your KSA done, you can submit that same KSA to every university you apply for. So I think generally, to give yourself the best chance, I would apply anywhere and everywhere, because you're free to do that. Like the doctorate, you apply, you can only pick 4. Here, you can apply to every job role, every university. So I think give yourself the best possible chance. But I think just be mindful about kind of your experience and what courses are looking for. I think there's no harm in popping in an application. But to anybody who sat there thinking, you know, I've got AP experience and I'm not sure whether, like, perhaps London would probably be the best suited place. From what I've heard Ella say about the Midlands, I would definitely just recommend kind of Midlands very strongly for people with alternative pathways rather than PWP, because that's the research that I've done and that's what I've found.
Yeah, and to answer your question, Abby, I think it should. I'm pretty sure they're quite interchangeable. If you've got the CYP or EMHP, you should still be eligible to apply once you've been in that job 2 years post-qualified as well. Does the trainee year count? Unfortunately not. If you're considering the trainee PWP, you've got to be PWP for 3 years, 1 year training, 2 years qualified. So is there a limit set by CBT? Is there a limit set by CBT for sessions per week once qualified? If you're talking about like the targets from the service, I think again that's just service based. If I've misunderstood that, or if Ella, you've understood something differently, let me know.
No, that's all good.
Are there any fully online courses? In terms of the way the high intensity course, which is different to like private Oxford, no. But I mean, to be honest, chances are, university for me and Ella has been remote online, and by remote online, I mean we're watching live lectures through Zoom or Teams or whatever. But yeah, not really in the sense that I'm kind of imagining it where you might be doing like online work and online course stuff. No.
We've got a question, Jason, around the intensity of the work. So obviously, yeah. I can't comment on how it would compare to PWP training, so I'll let you answer that. Yeah, but in terms of just say what we've got on Birmingham. So for Birmingham, we have to write 3 case studies and do 1 oral presentation and submit 3 videos to university to be marked against a marking criteria, which is called the CTSR. I don't think it's valuable to go into too much detail about that right now. And then 3 to our placement supervisor. So really, if you think about it over the whole year, you've got 6 videos of sessions to hand in and 4 case studies, which, I hope that alleviates some, stress or gives you some reassurance, because really, although it feels like it's a lot, it's more the reading and the competency and being prepared for sessions and the session plannings that take the time. I personally feel like I'm keeping on top of the coursework. I don't know about how you feel, Jason.
Yeah, so the good thing, Olivia, is there's no exam for the high intensity. So for anyone who's done a PWP, they'll know there's an exam and it's not the best exam. There isn't one on the high intensity. For me, it's similar to Ella's. It's a little different. I have to do 1 atrocious 5,000-word essay on a mental health disorder of my choice. I've picked social anxiety, so I need to talk about the disorder, talk about the model, the treatment, critique the model, and just summarize my learning. So it's an awful essay. And then similar to Ella, submitting live session tapes for them to review and mark against the CTSR. Right, and outline case studies. Those are pretty much it in terms of the submissions. So I'd say not much in quantity, but it's definitely big projects that you have to submit. So got a question about how much would you earn a month. So in IAPT you are on band 6 as a trainee, so that's about 30 to 35. As qualified, you'll come out of band 7, so that's like close to 40. And that's standard across the NHS, really. A qualified clinical psychologist, for example, is band 7. If you go for a managerial role, then you'll be hitting band 8. And I can tell you now, I know quite a few CBT therapists who are in Band 8 positions, so there is quite a lot of opportunity for that in the NHS. Is being a counsellor already, does that help the application? Yeah, I know a few counsellors who've had quite a bit of luck getting interviews and being given positions, so you'd be in a good position with counselling. And most counsellors do utilise CBT in their practice and have some level of training of CBT, so you can really bring that out in your application. Okay, and I think that kind of, we got Olivia's question. That's going to come out nicely to the next bit I want to focus on, which is talking about the application process and the interview. Before then, Ella, is anything else just about that, about the kind of job role or anything? I guess to sum up the job role in one, for anyone who's not familiar with IAPT, is you're delivering short-term therapy. So by short-term, an average of 12, maybe 15 sessions of CBT to people with depression and anxiety disorders. So social, PTSD, OCD, all those. And they are one-to-one. Now, you know what, Abby, recovery rate, I don't think anyone cares about that at step 3. No one's checked my recovery rates. In fact, the PHQ-9 GAD-7 pretty much means SODL in IAPT. In step 3, you pretty much are using more disorder specific measures and relying on those. And actually, one thing the course really highlight to me is how bad the PHQ-9 GAD-7 is at identifying difficulties, because it misses so much as well. Is PTSD client? Yep, it is much an obligation. You are expected to see one PTSD client in my uni, and I think Ella's nodding, so yes. Would the EMHP and CWP role be seen as equivalent? It should be. And if you can work with children after high training, can you work with adults after children's high training? As I know you can't go between the two as a PWP. Yeah, because you are a CBT therapist at the end of the day.
I've got a colleague in, I can't remember where she lives now, because we work remotely for the private company I mentioned I also work for, and she did children and young people CBT, and she works in an IAPT service. Yeah. Obviously they tend to try and give her the younger side of the caseload because that's kind of where most of her experience is in, but she can have adults on her caseload. Yeah,
and I would really, so just to highlight, I guess, some of the things, one of the things I've really kind of found part of the training, the difficulties, is the feeling of feeling de-skilled. It's a very tough course, no matter what background you come from. You are learning something very different, and it's very fast paced. So being de-skilled in the training is probably one of the hardest parts. You do, as a PWP, you think you have a little bit of something, and then you realize actually there's just so much more to it as well. I wanted to highlight that before. So, and we got Helen saying recovery rates will definitely be monitored. It is mandatory part of the IAPT program to evaluate outcomes. The CCGs will demand it. Possibly, I mean, Helen, you know more than me because you've got far more experience as a qualified CBT therapist yourself. So you'll know more. Up until now, no one's mentioned recovery rates to me. So that's probably why.
I think they're monitored generally, but they're not compared against your practice, because what it is like, say if you've got somebody with reoccurrent depression on your caseload, they might not actually recover. So they might go away and kind of, they might need longer sessions. It's really quite difficult, and they can always re-refer back to the service. So although kind of like they're monitored, if somebody didn't recover on your caseload, I don't think you get, well, I certainly haven't got penalised for it as of yet.
Yeah. So watch this space. We'll let you know.
Yeah. Maybe I might get into trouble soon. I don't know.
Yeah. We'll see. I'd say they're quite flexible though. My supervisors asked me to offer 18 sessions for one of my social anxiety cases, for example. So, for me, it's been quite flexible. For being in step 2, you have the comfort of knowing you can step up to step 3. Oh God, do I know that feeling of losing that boundary. It was one of my biggest fears. So for anyone who doesn't know, one of the nice things about step 2 is you have a client, it's not working, the treatment's not working, or they're coming across too complex. You have this lovely safety net of being able to say, okay, we're going to step you up to step 3 where you can get more intensive work, and that's it, job done. Whereas in IAPT, step 3 is the finishing point, and the only other place is a community mental health team in step 4, which is usually an external service. So you lose that safety net at step 3, and that was my biggest fears as well. One of the things I'm still getting used to, and I guess it's something I can only really advise, is to really kind of shed the responsibility every therapist carries in terms of being fully responsible for a client going into, quote, recovery. It is still short-term therapy, and if a client's coming with all complex difficulties, I think it's setting their expectations clearly on what you can and can't do, and making it clear you will focus on one good piece of work, and you can maybe signpost them to other places that might be able to help them afterwards. So that's pretty much the only advice I've got on that, is just kind of learning to drop the responsibility a little bit in terms of, I am fully responsible for this client getting everything they need from therapy, and I'm still learning that. Ella, have you got anything to add? Ella?
No, sorry, I was shaking my head.
Okay, sorry, I wasn't looking. Okay, so I think we could go on this forever, but let's talk a little bit about the application process. So we've already alluded to it a little bit in that each area is different. I have applied to many places, and I've interviewed with about 6 different universities. I can't remember most of them, but I'll tell you a little bit about what I remember. So the places I interviewed for King's, Birmingham, Sussex, Hertfordshire, Newcastle, and Surrey. I was offered 4 places. I was denied a place with Newcastle and Sussex, and I was offered a place with the other 4. Ella, you said you applied to a few places.
Yeah, I applied to about 12, was shortlisted for 1 and successful at 1.
Yeah. In terms of the application process itself, so the way you apply very much will vary. It's mostly through NHS jobs. So I would just go in the search bar of NHS jobs, type CBT trainee or trainee CBT therapist, filter it to band 6. You'll probably find a lot of roles there. KCL, as we mentioned, is through their online portal. So with that, you just very much follow an application process. One of the things I found differently is, if you're applying for a London service like KCL, and you're also applying through NHS jobs for others, you will need 2 different applications. And that is because KCL limit their word count quite substantially. So with NHS jobs, you have this lovely luxury of really being able to fit everything to the criteria one by one. With KCL, you really have to focus more on, how can I stand out as an applicant as well. So Ella,
I think, sorry, Jason, just picking up on that, I think that's the real, I think that's what really sold it for me, was having the luxury of going through. So, with the application process, my number 1 recommendation would be print off the job person specification and write a little bit about every area, or try and kind of tie a few areas into 1 paragraph and show how you meet that. And you can do that on NHS jobs quite comfortably. As Jason said, the King's application is very, very tight. So massive well done for that. And so I guess just be mindful of that. And the application on NHS jobs is pretty, straightforward. If anybody's applied to assistant psychology jobs before, it's pretty much a standard format, isn't it? You get kind of so many characters in 1 big bulk, and you talk about your previous experience. I think the application on NHS jobs isn't really explicit to the role, other than you kind of fit the character count to the person specification. There's not loads of additional questions or anything like that. It depends where you apply. Some might ask a few extra ones, or say, what would you do if you were in this scenario? But I would familiarize yourself with kind of general applications on NHS jobs anyway, and that profile form.
Yeah. So with any job, and I'm imagining many people here have a lot of clinical experience, and are familiar with applying to jobs in the NHS or private mental health services. And the key thing is really sticking to the person specs. And it's very difficult to generalize, because the fact of the matter is, everyone recruiting is going to look for something a little different. My golden rule is follow the person specs and try and fit it in order of the person specs, how I meet each criteria. I like to go with the idea that CBT being a very evidence-based type of therapy, I want to be evidence-based in my application. So when I say I have experience in something, I'm not just saying, oh, I have experience of working in CBT. I'm then going to demonstrate to them in writing how I've got that experience. So, and I would specify exactly what. So what I'm going to do is I'm actually going to maybe take a risk here and actually show my application, don't judge here. So this was my application. Can everyone see that? Yeah, nod. Can someone nod or just confirm? Yeah, okay. So what I did with this one is I kind of broke it down into different areas. Just kind of had an open statement, and then I just talked about the my PWP experience, and I tied that into what they would look for in a high intensity role. So, you know, as a PWP, you learn about symptoms and maintenance factors. As a PWP, you won't be treating these disorders, but you are doing triage assessments, so you will have an understanding of what the diagnostic characteristics are. You would have a familiarity in using the specific disorder measures like health anxiety inventory. This one has changed now to the PCL5. It used to be IESR. So I'm really being explicit in how my experience ties to what they're looking for. I'm talking about, when I talk about how I recognize these, I've explicitly mentioned I'm using the 5 areas model. So I'm not just assuming that they know what I'm talking about or, you know, trust me. I'm actually really specifying what have I done, how does it meet, and, you know, how can I evidence that? So for example, again, showing how I recognize the signs and symptoms of more complex disorders, I use the 5 areas. I use specific outcome measures like the health anxiety inventory. You know, again, I'm talking, what was I talking about here? Yeah, and then of course, as a step 2, again, anyone as a PWP will know, weekly case management, 50% of the clients you work with are expected to be stepped up. You will have experiences in recognizing when a client needs to be stepped up and the experience of that process as well. Again, talking a little bit about my role, talking about CBT, talking about what I work with, all sorts.
Just to interject there, Jason,
yeah.
For anybody who hasn't done IAPT and PWP before, there will be some knowledge that you will have to kind of do some reading for the application process, because you need to clearly outline your understanding of stepped care. So if you kind of don't have stepped care in the service you work in, I definitely recommend kind of reading up on IAPT and just kind of alluding to the fact that you have familiarized yourself with that.
Yeah, absolutely. And I think, again, really good to mention that you understand models, because, you know, as a PWP, you don't get to fully learn the different models of disorders. But for example, when you're working with panic, you're going to be aware of Clark's model of panic, for example. You know, just talking about that, you know, MDT work, you're, you know, as a PWP or anywhere really, you're going to be liaising with quite a few different professionals. As a PWP, for better or worse, if there's any GPs here, I'm sorry, but for better or worse, you do liaise with GPs quite regularly, or social workers. So showing that supervision, massive. Ella said earlier that supervision is a massive thing they'll be looking for as well. So demonstrating your experience of supervision here, demonstrating how you use supervision. So what capacity is it done? What you use, how you use supervision, what you've learned from it, and how it's benefited you, because they really want to see a reflective practitioner in this course as well. Again, this might be more useful for someone who doesn't come from a traditional IAPT background, you know, talking about anywhere else where you got CBT experience. So, you know, I'm just talking about, you know, any other bits I had. So where I set up a group for parents using BA work for depression, also. So CBT is utilized, I'd say CBT is going to be utilized in some capacity in your work, and it's being creative to really dig that out as well. So that's pretty much it. Risk, another key thing, you are constantly managing risk to some degree. Therapeutic alliance, also. So that's just a kind of quick look at some of those things. And really what I'd say from that is it's just about saying how you meet the person's specs, not just saying you do meet it, but explaining how you meet it, what you've learned from that, what are the challenges, really going into detail where possible. Ella, do you want to add anything on to that?
No, I just think that's really important. I think, like, you know, I've applied loads of times to different things, and I always get told, you know, print the person spec and really show how you evidence it, not just saying that you can, but giving clear examples. And I almost was a little bit dismissive to it. But actually, it's so valuable and it's so important. And I feel that's what worked for me. So I don't think there are any tricks. It simply is saying kind of how you meet that criteria and giving a clear example of, you know, demonstrating that.
Yeah, and that's going to be the same for your interviews as well, which we'll go on to. But anyone who's got experiences of interviewing, you know, when you're given an answer, they want to see that reflection. They want to see you think about things. Yeah, Helen makes a good point about the primacy and recency effect. Absolutely. If you think people are seeing a number of applications and these do come pouring in, you know, you want to be the one that sticks out as well. With KCL, the application, as I mentioned, is a bit different, and the advice I was given by my supervisor, the clinical lead of my service, was, well, they know you're a PWP, so they will know immediately what you do. So what you want to focus your words on is the extra things you've done that they wouldn't expect from a PWP. So I was a senior at the time I applied, so I based a lot of that on, you know, what I did as a senior, supervising, risk management, duty work. I also talked about my specialisms, the fact that I was a guest tutor at the UCL course, or that I was part of the service user involvement program or the drugs and alcohol. And that's what I chose to focus my limited word count on, was just the things that helped me stand out. And I'm glad I did, because like I said, 90% of the course on my course are PWPs, so we're not that special in KCL anyway. Yeah. Ella, do you want to add anything on to that?
No, I've just posted a link into the IAPT manual there, which would be a really good place to start for anybody who's not familiar to IAPT. So just make sure you copy and paste that out of the chat prior to leaving today. Yeah,
great. So any questions about the application process before we... No worries, Iris, thanks for coming. Any questions about the application process before we move on to the interviews?
Other than the KSA, which we'll
come back to. The KSA, we will get to that. Feel free to post it in the chat or just unmic yourself.
I guess the three main points I would say is research where you're applying to make sure that it suits your experience. You know, maybe apply to as many places as possible because you've got nothing to lose. That opportunity's there. Give yourself the best opportunity. And the third top tip is definitely print off that job spec.
Yeah. Okay. So so no questions then. So let's go on to the interview then. So you're lucky enough, you got your interview. How do we go? So Ella, I kind of took over the last bit, so I'll let you start off.
Well, I guess we were really I was very fortunate to share the journey with Jason, and you actually come up with a document, didn't you, from all your interviews, which identified key themes in the interview process. Obviously, I'm conscious of time and it being kind of just gone 7 o'clock. So
we'll be going over.
I think, yeah. So I think like maybe it might just be really helpful for Jason. I don't know if you've got that document to hand, just to kind of highlight some of those key areas.
Yeah, I can't make it clear, guys. I'm not going to share this document with anyone, just because, you know, it is going to just be a bit unfair. I'll talk about the key things, but I'm not going to share specific ones.
Yeah, definitely. Just kind of like the key themes. And I guess just to touch upon some of those. So risk is really important. How to kind of devise, you know, a treatment pathway for a particular presentation would be really useful. Why you want to be a CBT therapist come up quite a lot, and kind of why you value the role and why now. I think effective use of supervision was another key theme. Have I missed?
So no, you touched upon the main ones, I think. Another one I got was, and I mentioned earlier, is just kind of the challenges you expect to face. It's a very intensive training year course, and they want to know that, you know, you've taken time to reflect on what are some of the challenges. One of the things I was told by my old supervisor who trained at Royal Holloway was that whenever you're answering, kind of giving a negative answer, so i.e. weaknesses or challenges, it's also good to kind of add a little bit at the end about how you would overcome that. even if they don't
Definitely.
explicitly ask for it. So the example I shared was around, as I mentioned, around kind of being didactic as a PWP, and, you know, kind of getting into the habit of focusing more around guided discovery, Socratic questioning. And I was quite open about that, and I just highlighted, well, you know, this is what I've learned as a PWP. It's going to take time, and it's going to feel weird to kind of unlearn a lot of those key things that have been core to my work for a long time. And I just added how I would overcome that. So utilizing supervision, recording my sessions, getting feedback, role playing, you know, they didn't explicitly ask me how I would overcome that, but I didn't want to leave them with a bad impression of me, and actually being able to be honest about my difficulties, but actually also say I'm reflective enough to know how I'm going to manage that, would get you extra points as well.
And you don't need to have extensive experience with an understanding of kind of all mental health issues like OCD and panic. I think, you know, they might present you with one case and kind of ask you kind of how you might proceed with that. The risk questions generally are kind of, if somebody in a session disclosed that they had thoughts of taking their own life or they were going to harm themselves in any way, how would you manage that? So as Jason said earlier, you know, everybody here is probably, you know, very experienced clinical practitioners. So it's stuff you probably already know, but I guess it's just being aware of those key things. And, you know, risk was a really big one. And I think what you touched upon there, Jason, as well, is, you know, I think they do really want to hear, you know, what do you envisage is going to be difficult, and, you know, and how you overcome them. I think that was on so many applications, wasn't it, Jason?
Yeah, absolutely. So there was that, and I'm just trying to think, what's the other thing? I just saw it and I've just left my mind. Oh, another big thing that I think you'll have to get used to is role playing. And I think pretty much every interview I had some form of role play, except the Birmingham one. Did that one?
Yeah, none for Birmingham.
No, but I had to with all the others. And do we need to know the NICE guidelines? I'd say just be aware of it. Just kind of show your awareness of it. You don't need to know the ins and outs. You don't need to know the ins and outs of everything. Remember, you're a trainee. And I don't think many qualified CBT therapists could say exactly 11.2 of this particular NICE guidelines, it specifies this thing. I think it's just saying I'm aware of where I'll get that information if I struggled. So I'm aware that NICE guidelines exist.
Yeah, or if somebody, a case presentation you were given that they had anxiety and depression, just that awareness that NICE guidelines would recommend that you would treat the depression first.
Yeah, depression first, unless there's a reason like the anxiety's caused the depression or something like that. Yeah. Again, I think Einstein said it best. Someone asked him a question and he said, "Why would I need to know that? I've written it in my book." So something along those lines. I've butchered that quote, but he said something along those lines. So role play is a big part of it, and the thing to remember about role plays is they're not looking at, you know, knowing your stuff is going to be important, but I think the feeling I got was they cared more about my interpersonal skills and just seeing how I can come across as a therapist, and just the idea of being able to normalize. So to give a bit of an idea, a few of the role plays I did was around a first session with someone, and it was just kind of understanding what the disorder was. Sometimes it was make sure they understand what CBT is, or you know, another one was dealing with a concern that the client had. And to be honest, one of them, Surrey, in fact, I didn't actually finish everything in time. So I was about explaining CBT to the client, and I spent so much time at the beginning and normalizing and getting to know him that I didn't actually get to finish explaining CBT. So at that point I thought, well, I've botched it, that's done. And actually no, I was offered a position because I think what they were more interested in was actually just seeing how I can relate to someone who's going to potentially could be a client. So your interpersonal skills will be key in the role plays. You know, again, one of the things I was asked is, based on that discussion, what disorder do you think they had? They're going to keep it to what you'll see in IAP. So it's not going to be like, oh, psychosis or personality disorder or so forth. It's going to be like depression or anxiety. And again, I don't think you need to be exactly right, just kind of where you think it might be. And if you're not fully sure, just letting them say, oh, I'm not fully sure, it could be this. These are the sort of things I'd want to ask to find out as well. And then they ask me typically, how do you think the role play went? And then at that point, you just want to give, you know, reflect on that a little bit as well. So role play is to be expected, I would say, unless you go to Birmingham. But Birmingham had you do a test, just an FYI.
Yeah, that's a really important point. So Birmingham got you to read a literature review, and then it asked you a number of questions after it. Yeah.
One thing I think would really help for the interview is to, and Ella mentioned this earlier, is to look up the CTSR. The CTSR is pretty much a criteria you're marked against on the training for your treatment tapes, so your therapy sessions, and there's a CTSA for assessments, but similar things. I would look up the CTSR, just Google it, CTSR, Google it, it will come up with a document and it tells you each point. So it's things like eliciting cognitions, you know, I think there was something about eliciting behaviors, guided discovery, setting an agenda. I would take a look at that and see how your experiences and skills can meet that, because then you can really show that in the interview and really allude to it. And if you mention the CTSR in the interview, then they'll probably love you as well. I did, and it was quite good. Oh, thanks, Ella. So Ella's just put the link in for it. So really recommend taking a look at the CTSR, and actually you can use that as a way of helping you with your application as well. So that will be quite a good guiding point, I believe. Don't solve your everything around the CTSR, but just have some awareness and just think a little bit about how do I meet some of these already? How can I meet some of these? Ella, you got anything to add on that?
No, just a question there was about splitting the course. To my knowledge, you can't split the course. It's 12 months full time.
No, I'm afraid not. Okay. Oh, we ended up recording. We weren't going to record, but the recording was set automatically. I'll probably put it on our Facebook group then, since it's already recording. Okay, so
we were a bit skeptical, weren't we, Jason? Just because, you know, I think it's good for people to come, but we will be doing another one. So if people have to go, or, you know.
Well, I mean, it's recording anyway, so I might as well upload it.
Yeah, definitely.
So any questions about the interview? I would really stress, so I had an interview with Edinburgh Uni for the DCLIN twice, last year and the year before. And the first year I went, I got reserve. I was second on the reserve list. So I was really close, and I'm going to chuff myself up for that all day long, because that was really close. And I went for it, and I didn't know what to expect. I prepared a little bit, but I went in as myself. I was really honest about myself, and I tried to show who I was as a person. And I got a reserve spot. The year after, I actually really tried to answer in the way I thought they wanted, and tried to come across as a very competent practitioner, researcher, psychologist. And I didn't get anywhere. I got no offer or even a reserve. So I'd really try and, you know, someone mentioned it in the comments earlier, Helen, I believe. Try and show yourself, be honest, show your personality. If you don't know the answer to something, I think I would say it's okay to admit that, but say how you would go across learning that as well. So don't be robotic, just really try and be yourself, because that will shine through as well. Anything else? Oh, in the Facebook group, I don't know if anyone is here in the UK. Oh god, it's a long name. What's our group called?
UK Clinical Doctorate Applicants, something like that.
UK Clinical Psychology Doctorate Applicants. That's the group me and Ella run.
Out group, yeah, not sure.
We'll post it there. So yeah. So anything else about the interview?
I'm just answering one, sorry. There was one that I've just...
Sure. Okay, so I guess at this stage, any questions generally before we go on to the KSA? I'll give you 10 seconds to let me know. Okay. So I guess at that point, if you have a core profession, then I guess you are free to leave. and and thank you for coming, although I'm getting the feeling that everyone's a PWP, or not a PWP, but everyone needs to do a KSA.
Yeah, thank you everyone for coming. We were really lucky, weren't we, Jason, to have the support of people supporting us on our application. So I guess that's the motivation for wanting to do this for others. So anybody who is dipping off, just buy, and hopefully we'll have another one soon.
Great. Okay. Someone's saying KSA, so I think someone's definitely eager, and I think ER has definitely alluded that they're here for the KSA before. Okay, so Ella has just linked a website to the BABCP as well. So hopefully many of you who've kind of looked into the process are aware of this. Before we're going to each individual KSA, the one thing I really want to stress to you guys is, do not look at the KSA as one big sum of a work, because it's going to be overbearing, you're going to get confused, you're going to feel overwhelmed. Try to focus on each individual section. It's broken down into 13, 14 components. What helped me was focusing on one section at a time and ignoring the rest. So, okay, great. And Leonie has kindly uploaded all the guides on the IAPT group a few months ago, so it's also there. What I'm going to do is I'm just going to download the guidelines for assembling, because we're going to use that, so bear with me.
Yes, whilst Jason's doing that, just to reiterate this, it is a very big piece of work. It does seem very daunting, but 100% you've just got to take it, one KSA criteria at a time. And I think I booked 2 weeks annual leave. And then on top of that, I probably did a couple of weekends, and that was taking it at quite a slow pace. And I was leaving a job, so I had annual leave to take at the end. So, but then I've got colleagues that have written it in kind of a week before, so it's different strokes for different folks, but I wouldn't recommend doing the latter. I think, one day at a time and about a 2-week period is sufficient to complete this.
Yeah, absolutely.
If you're doing it in one block. Otherwise, I think what you did, Jason, you started doing it way before, didn't you? And just kind of tackled 1 or 2 per weekend.
So I aim to do 1 a month. And so I started from now, and it meant that I pretty much had a working draft by the time I needed it as well. So I'm just going to share the screen. So this here is the guidelines to assembling the KSA, and it's again, when I first read it, it was a really intimidating document, but I think if you kind of just look at this one thing at a time, break it down, it definitely makes life a lot easier. So I'm someone who likes to do things quite in order. I don't like going all over the place. I do things one by one. I feel like I need to do the first step before I go to the second step. So that meant for me, I started with the first KSA, which is life stages and human development as well. So with this one, they're pretty much looking for the experience. And I was just going to say, Helen has quite a lot of experience with the KSA. She runs workshops. So Helen, at any point, if there's anything you want to add, we'll probably welcome your input.
Oh, please, yeah. So me and Jason are not experts here. We're just literally 2 trainees that want to impart our experience. Yeah. So yeah, if there are any qualified on the call, please pipe over.
Well, both of our KSAs did pass, by the way. So we're quite lucky there.
But we've got a very helpful message from Helen. Oh. And actually, I'm not going to lie, that's the way I did it.
Yeah. I can't see it because I'm sharing.
So it's often easier to start with the skills criteria and attitudes, as the knowledge sections tend to be heavier and more demanding. And I would agree with that. I guess in our practice, if you think about CBT, we would always go for the behavioural change first, go for the easiest wins first. So for me, that's what I did with my KSA, and I definitely did what Helen's recommended there. I did the things that I found would be easier to evidence first, so that I kind of got to a point where I'd done 50% and I felt really kind of like achieved, and it really motivated me to keep ploughing on. And I think I did the knowledge section last, because that is the most difficult.
Yeah, I did knowledge section first. I didn't recognize there was, if anything, I found the attitudes harder because I felt that was a bit more wishy-washy to me. But but I'd say that's pretty good advice if that's kind of, you're in the same boat as Ella. And
it's the BABCP website, by the way, for the document Jason's sharing. I just shared the link to it, so if you scroll back up, you can go onto the website.
To assembling the portfolio.
And there's one for applications, their clinical supervisors, and anybody who's going to be providing references.
Yes, absolutely. So so if that case, let's go, you know, I'm going to take Helen's advice on this. So let's start with the first one, the skills. So here you're looking at competency and key relationship skills. So one thing KCL, Suzanne, the course leader of KCL, said to us was around the KSA is that every university will prioritize different KSAs over others. So for example, KCL said, we're not so bothered about some of the KSAs as much. You know, we want to see some things, but for the most part, we kind of know that you guys would have met this through the fact that you got an interview and we offered you a position. I'll take a look and see which one she was alluding to there. But competency and key relationship skills. So if you just read it, it tells you exactly what they want to see referenced in each section. So pretty much it's telling you how to go about meeting it. So, you know, anyone who's worked in mental health or healthcare in general is going to utilize this. Pretty much any job in the world is going to utilize this. Because what are key relationship skills? Well, you're building up trust, rapport, you know, psychotherapeutic relationship skills, all those things as well. So you will have experience and knowledge to draw from when writing about this one. For me, oh God, what's the name of that person? Ella, you take over while I find the name of the person.
I was replying in the chat, sorry. So I'll just pick up some questions whilst you do that. Okay. So in terms of around kind of if you don't pass a KSA criteria, so a lot of universities will get you to provide a draft during the application process. So I guess they'll consider that when they're considering your suitability for the role, and they might offer some feedback on kind of areas you can develop. So Birmingham, for example, don't require the KSA upfront prior to the application of the course. But what I will say is their interview is very much geared around this KSA. So if they didn't feel you were competent enough to complete and pass the KSA, they wouldn't be probably looking to offer you a position. So I've got colleagues and myself, I didn't pass one area of the KSA, and I was just supported by my tutor to kind of think about how I could express that or put my previous experience in a different way. So there's lots of support once you're on the course for somewhere like Birmingham in terms of helping you to pass. Like, this isn't kind of a thing to be scared of, like where, you know, you get fail it and you get kicked off the course. I think it's just a way to evidence that you're in a position to study and work to this level. And I think universities are very supportive and encouraging when completing it. I know, Jason, your university provided a lot of lectures, didn't they, particularly around giving guidance on how to do it?
So if you are with Royal Holloway or KCL, you get the one good thing that other courses don't seem to offer, and I'll talk a bit, and this is in particular to this monstrosity, which anyone here recognize models of therapy as a KSA?
Yeah. There's another question here. Is the KSA standard across all universities? Yes, it is, other than some universities might require you to type them onto their own templates. But generally, if you download the templates on the BABCP and do them on there initially, it's only a case of copy and paste.
I'll say good luck. It has one of the worst formattings ever, the template they provide. Wouldn't let me put my signature, wouldn't let me change from bold. It kept the format. Yeah, it was awful. But yeah, they provide you a template. So looking at number 5, looking at key relationship skills. So like I said, I think anyone here will have that experience to some degree. And I was just having a quick read over my one. And, you know, for me, the way I kind of started off with mine was, you know, again, talking about my experiences of where I would have used it. So just trying to find a quote. Yeah, so for example, training on the low intensity CBT training, I was required to learn the fundamentals of building a rapport with the client, which was done through various lectures I attended, and so on. If you're a PWP, you know you are assessed on your assessment skills and you have to submit a treatment tape. So there's an excellent way to demonstrate that. Actually, I was assessed on my ability to develop interpersonal skills with my clients and I passed it. So there's a great bit of evidence there. So if you've got PWP, there's a nice bit of something to work on there. You know, when you're talking about competency and key relationship skills, I find it's useful to reference things like motivational interviewing. Again, that's something a lot of people would have used as well, using open-ended questions, active listening. You want to reference those things as well. So I'd say this one's not many people should have a problem with, but is there anyone who's got a specific question about number 5? And you'll have to keep an eye on the chat because I can't see it.
Yeah, I'm doing that now. I'm just gonna, if there are answers I can type replies to, that's what I'm gonna do.
Okay.
Just to keep the focus of the chat on.
Yeah, okay. So then we got number 6, so maintain and manage records and reports. So again, if you're working in any full of healthcare setting, this is something you're going to do. You're going to be maintaining, managing records and reports. You've got notes from whatever work you do, uploading documents, writing letters. All of that is very important. Again, if you're a PWP and you use IAPTUS, well, what are you doing? You write reports for assessments, your treatments, you are writing letters to GPs, you are writing referrals to community mental health teams, all sorts. So there's quite a lot to work with there. Supervision, again, if you, depending, IAPTUS supervision is quite formal in that you have to kind of submit a record through IAPTUS or whatever software you might be using. So again, that's something else to write about. So what about you, Ella? Because again, someone from a non-IAPT background, how did you, what were some of the things you leaned on for number 6?
Number 6, maintaining and manage records and reports. I guess it was just, I worked remotely. Sorry, we didn't have an office space for the private psychology company I worked for. So it was just, you know, that standard stuff around kind of confidentiality, making sure things are kind of kept in the right places. I put a lot of my certificates on here and staff training. Yeah. I feel like certificates are the easy wins for the KSA. So even like anything like data protection and making sure, you know, clinical governance training, anything like that, all these certificates are really valuable here, and you can kind of say what you've learned from completing that course and how you've actioned it. So for me, working for the private psychology company, we didn't have an office, so for me it was about password protecting documents, making sure I'm not carrying hard copies of personal information, making sure that once I'm home that's locked into a filing cabinet. It's just those clear examples.
Yeah.
And exactly. Any reports you've written, you know, any kind of formulations.
Yeah. And one thing you want to definitely keep your eye on for each point is the evidence section for how you're going to back it up. So there is a minimum you need to meet. And for the skills section, you need the counter signature reference. So this was a bit confusing for me initially, but on the KSA website that Ella put in the chat, you have the templates for everything you need. And for KSAs 5 to 10, which covered the skills section, you need someone, a supervisor or something, to just say that they've read your self-statement and they can attest to what you write being true. So what I'll do is I'm going to just demonstrate what that looks like, if I can find one. So here, I'll show number 5. Okay, so this is my 5th KSA. I wrote a lot. Not many people do. My friend Jake, who got on Surrey the year before me, his was very. His was only like a page. I overdo it with my work. So not to say you have to look at this and think, oh my god, I got to write all of this. No, I'm just excessive. But this template here has a section for me to write my self-statement. So again, this is just me saying, ignore that, I made a mistake there. This is number 5. I put 10 by mistake. That's how confused I got. But this is number 5. So again, each bit I just talk about my experiences, how I met it. And what's good is for you to give a very outline a specific example of when you met that criteria. And here at the bottom you can see that I've got a signature, which, you know, she done it digitally because that's accepted, from my supervisor at the time, who just attested that, yep, I agree, he does this, he meets this. So
Jason, there's a few questions here, sorry. So that kind of linked to this. So it was like word count, is it around 800 per KSA? I can't remember. Is it 5 to 800? There's not kind of a limit, and you know, there's not there's not a limit, but as long as you can evidence it, you don't have to write to the end on earth. Like if you've got certificates that show that competency, you don't actually have to write a lot other than your kind of example of implementing that in practice. And somebody else asked, how do you decide between a reference and a counter signature? So the BABCP clearly outlines. So there's some which you can write in evidence yourself. There's some which you need a counter signature for, which says, yeah, everything Ella's written about her competency here, I've witnessed and I agree with. And then there's 3 then that you need an actual reference for. So ideally, you know, 2 different people to provide that written reference for you. But the link to the BABCP, I can't remember off the top of my head what they are exactly.
It's broken out into knowledge, skills, and whatever the A stands for again.
Attitudes.
Yeah, thank you. And I said that with such attitude, didn't I? So knowledge, self-statement is enough. You don't need to get a reference for that. Skills, it's the counter signature. You want someone to say, yes, I've witnessed this and I agree to it. And attitude, they want a actual written reference from either.
In terms of the references and counter signatures, you definitely need to be looking for a minimum of 2 different people. I probably got about 5. It just shows like, I think it shows like a broader witnessing of your clinical development. So if you just kind of go in with one person signing everything, you're going to be told to go and get different references for a start. But secondly, you know, just think back, you know, it's really helpful, I think, to have a wide range of signatures on here, because how does, you know, that just shows like clinically your experience and a wide breadth of people that have witnessed your practice. So I think it's really encouraging for them to see different names.
I will say for me, I was told that for the counter signature, it could be all the same people. That might just be KCL, but that was accepted. So one person did all my counter signatures. For the full references, I think, like you said, Ella, I think you said it's got to be at least 2 different people.
Yeah.
I got 3 people because I just had that luxury where I was lucky enough to have 3 people be able to write me one. But yeah, counter signature can be all the same in my experience as well. So any questions about 6 or any other questions before I go on to 7? Right. So 7, again, it's broken down, and as you can see, like we said, it says reference here is the counter signature. This is what confused me, but this is what they mean, is counter signature. And again, just reading it, you know, what they want to see is the ability to maintain effective and appropriate communications with internal, external, interested parties. So GPs, social workers, teachers, nurses, all sorts. There's that, you know, any contact you've had with them will be useful to add to this as well. And I think anyone with experience in mental health would have met this to some degree. So these, I would say, yeah, kind of think of what Helen said, these are quite easy to meet for a lot of people, because, you know, if you're feeling in a position that you're ready to apply for the high intensity, then you would probably have had these experiences as well. They're not so specific. And then that's just continued. Risk. So risk, again, anyone working in healthcare will have some sort of experience working with risk. Like I said earlier, it's good to kind of outline specific examples of how you've met these and kind of give a bit of a scenario to them. What I was told by KCL, they wanted 2 specific examples of the awareness of risk, and she said to me, here you go, look, 2 illustrations. So it's written here. So with the illustration, she said to me, I wouldn't want to see 2 examples of suicide. I'd maybe want to see an example of suicide, eating disorders, neglect, self-harm. They want to see a bit of flavour. So just bearing that in mind when you're writing about risk, and risk is a very wide area. So when people think of risk, they might think of suicide, but actually risk, you're thinking about risk from others, risk to others, risk to self, and that opens up a lot of different areas. Ella, anything to add on that?
No.
As well. So the chat's buzzing, I can see, but I can't see it. Is there anything?
I've answered them.
Right. Comprehension of research. So this one, I'd say it can be a little tricky if you don't have an degree in psychology. So if you've got an undergraduate or a master's, then you're pretty much good to go with this, because as part of doing a psychology degree, again, I could be wrong. Other courses you might be sitting there and think, oh, I did sociology or something and we had to do research. Fair enough, I don't know. But with psychology, you're guaranteed to be doing that. You're writing a dissertation. You're obviously learning to critique research. You're writing essays, so you can really lean on that as an example. I did use other things, and I'm just going to open it up to see what else I wrote. So looking at my KSA, I can see I mentioned my BSc in Psychology of Criminology. Just really broke it down into the modules. So what modules I did, me passing them, demonstrating that I meet them. And then research, again, is quite a wide area. So thinking about yourself as a reflective practitioner, when have you used research to inform your practice? So the example I gave was what was it? So I mentioned that how when I feel I've struggled somewhere, I will research to understand things further. So for example, at the time, you know, we were looking at Black Lives Matters. This was when I was writing my KSA, so it's quite topical. And I said that as a PWP, I wasn't fully aware of the need to kind of meet the BAME community. I'm aware that they developed guidelines for that. And so I took it upon myself to read that, but also look at up and coming research. And I believe there was quite a lot of research around that. And then I just talked about how by reading that, how it informed my practice, how it changed me as a practitioner. So that's another example of research as well. That if you don't have something more traditional with undergrad, that's another good way to go about it. Other things I mentioned was when I was a PWP, I did conduct a lot of service audits. And I used that to look at things like the recovery rates across all the different treatments we offered. And I presented that to the team meeting, and that led to some changes. So there's a lot to work with on that. Ella, have you got anything else to add?
No.
No. So any questions for number 9? No. So this is, oh no, we're still on skills. Are we skills? Yeah. So number 10 is commitment to ethical principles. So, you know, hopefully everyone here is ethical and you follow a strict guidelines, you know, all these things. So, you know, all of these things count as commitment to ethical principles. So for example, confidentiality. Anywhere you work, you're going to have a confidentiality policy that you're going to adhere to. And there's a lot of interesting things you can write, especially if you work with children, because confidentiality with children can be a really muddy area. Because where do you draw on the line between a child telling you something and asking you not to tell their parents to, I might need to share this with the parents. So there's a lot of interesting things you can write about that. Again, as a PWP, confidentiality. I don't know if anyone has ever had an experience where they're working with a client and then a client's loved one calls concerned about their client, and they call in you for reassurance and trying to elicit some information about what you're doing. Anyone, any nods about that? That's a fantastic thing to add, I think, because you're demonstrating that that's a very difficult situation, because naturally you've got a loved one who's concerned, you want to help and reassure them, but of course we have to consider the confidentiality of the client we're working with. If that client hasn't expressed in writing that they're happy for us to share information, then we have to stick to those guidelines, don't we? So that's another thing to write. You know, equality and diversity, again, just this idea of, you know, when you work with people, you treat everyone equally. Boundaries are important because they protect you, they protect the client as well. So, you know, fairness and respect. So there's a lot of things to add in there as well. So, you know, just a few ideas. Anyone have any questions about that or anything to add, Ella?
No, Helen's just put in some really useful comments as we go in the chat, so I just draw people's attention to that.
Right.
As an experienced CBT practititioner, you know, it's really valued to have that input.
Yeah.
So it was just kind of a mention around kind of recognizing positive risk taking. It isn't always about being too cautious. And in relation to what you've just been discussing, reference an ethical framework or theory to include ethical dilemmas as examples?
Yeah, absolutely. And so that brings us to this one here, attitudes. And this is the bit where it's funny, Helen was saying that attitudes is a bit easier than knowledge. I hated the attitudes section. I found it so wishy-washy for me. I did this last, and it was the bit I hated the most. But with fitness to practice and suitable at a personal level, so at this point you need a full reference from someone who can attest to the fact that you meet 11 comfortably. So one of the easiest things you can add to 11 is you have a DBS. That's one of the first things I opened with, was the fact that I have a DBS. I've got this DBS. It shows there are no exclusions to practice as a therapist or in working settings. There's proof right there that there aren't any concerns about me. So that's a very easy one to kind of go with. And then I just talked a little bit about, as a senior, in terms of my fitness practice, my clinical notes, making sure all my clinical notes are up to date, that they meet the standards set out by the service and only contain, sorry, my dog's under my chair making noise, so I just wondered what that was. It sounded like a snake. So I talked about how, as a PWP, I'm making sure only my information is factual. I'm not adding any personal things in there. So, this client was really noisy, or they really pissed me off, as an example. And then I talked about, I again gave an illustration. So I mentioned a woman I was working with who referred to the service following the passing of their husband over a year ago. The GP said that CBT would be beneficial. However, speaking to the patient, it was apparent that they felt that bereavement would be more useful. Still trying to see what was my point in this. So the reason I talked about that is, even though the GP wanted the client to have CBT, I took the client's needs into account. So, I was saying, well, the client wants to focus on this. I made sure they had all the knowledge they needed. They knew exactly what the options were, and had it be client-led in their decisions.
Yeah, the easy win on this one, I think, is client therapist boundaries.
Yeah.
So just reflecting on a time where somebody's probably tried to push the boundaries, how did you kind of reflect on that? What did you notice and how did you overcome it? So I think the example I gave of this was a teenage girl asked for my mobile number in crisis, so she could ring me in crisis. So it was about managing that, kind of obviously not providing the mobile phone, providing a rationale why, and then providing her with crisis phone numbers such as Samaritans.
Absolutely, really going into those boundaries are very key as well. And then brings us to 12, self-evaluation, reflection. So I said earlier, they're really keen on self-reflection, reflective practitioners for the training. If you're a PWP, you have been drilled into the head about being a reflective practitioner, so you have a lot to draw on there. You can utilize the fact that how you use your case management, the fact you get clinical skills, and the supervision you got as part of your PWP training through the university when they had the seminar groups, assuming every PWP course offers that. So there is a lot to draw on in terms of that. And I really kind of mention here how I use my reflection. So I always use supervision in order to manage any difficult situation. So when I've experienced something highly emotive, when I feel de-skilled, when I'm doubting myself, when I've come across a client that has projected a lot of anxiety onto me and I feel anxious, demonstrating that those things happen, because they do. Anyone, and I'm sure Helen, as an experienced therapist, would be the first to admit it still happens. And that's just the key part. We're not machines. We experience difficulties, and you need to be able to say, I admit to that, I recognize that when that happens, I use the opportunity to reflect, to be aware of that and make sure it doesn't impede on my work, as a nice example of that. Ella, so anything to add, Ella?
No, I guess just to kind of add an example that I gave personally for that, it was kind of getting anxiety transference from a client, and really talking about how that impacted me, having the confidence to, I thought, well, if I take that to supervision, I'm just going to get labelled as anxious and therefore I won't be an effective CBT therapist. And that was like my own, negative automatic thoughts and underlying assumptions that I held, which were really unhelpful, and it didn't allow me to effectively help the client. So it was about actually recognising supervision is really key in overcoming these difficulties and challenging those beliefs. That wasn't a helpful belief to hold, and by going to supervision and being open about that experience, I was then able to come up with a strategy to overcome it, which was imagining myself in a bubble prior to this young lady's CBT sessions, which provided the safety and the distance from that anxiety, which enabled me to manage that better and therefore provide better therapy. And I think these really real life examples where you really show the connection to your emotions are really well placed here, and having the confidence to say, actually, this is something that did happen for me. We're not perfect, we are human.
Absolutely. Are there any questions about 12 before we go to 13? No. So 13, again, so we mentioned EBD, this is where I'm at, CBT is a evidence-based treatment. Evidence. Therefore, they want to see that you are a scientist practitioner. Scientist practitioners, you are someone who leans on the evidence, you put theory into practice, you base your practice comes from the theory and the research. And they want to see that you are someone who is inquisitive about that, who's receptive to learning. So again, there's a number of ways to be creative about this. And I was just having a skim of my one when I kind of met this. So Ella, take over while I get a sense of my KSA.
Yeah, no, it's okay. Mine seems to have like scarred in my brain, so I can remember mine off the top of my head. So for me, I was supporting a young boy with ASD, and I'd supported lots of children with ASD, but the different thing about this young boy was actually, sadly, he lost his mom. I'd also worked with children who had suffered bereavement, but I'd never worked with a combination of children who suffered bereavement and had a diagnosis of ASD. So what I did there was kind of do some research into that area, how to best support them, what activities and strategies are most effective. And I also contacted a local charity called Winston's Wish to get support from their clinical practitioners in how to best support this child, because that wasn't my area of expertise. So along with that charity and myself and the research I did, I was able to put together a more effective treatment plan.
Yeah.
And Jason, Helen's just put in the group chat explaining, what do you understand by the term scientist practitioner? Where did that model come from? And, is it the only way to work in CBT, and be critical in this section?
Yeah, absolutely. And being critical, definitely. And I'm just looking at mine. So, I reference how I use guidelines to help inform my practice, and I kind of illustrate that. So, nice guidelines typically suggest working with depression in the first instance, unless it's quite evident that the issues are anxiety based. I talked about, as a senior, I was case managing and supervised triage assessments. So I need to make decisions that lead to the treatment I'm required to make decisions regarding treatment protocol. So I need to rely on the evidence. I need to rely on the diagnostic criteria. I need to rely on what I'm being told, what the client's saying. And I need to be inquisitive in what to ask, because as anyone who's ever supervised supervisees might not know the information you're looking for. So you need to be able to think, okay, I am curious about this, and knowing what to ask around that. So again, it can go beyond the scientist practitioner approach. You can be creative with that. I talked about my experience as a research assistant, and so going a bit more traditional and so on. But yeah, there's a number of ways to draw on that as well. I'd say this probably was the hardest one for me to write, because again, it can be quite broad as well. But I would say get an understanding of what this means and work your way from there as well. I'm not going to go on 14 really, because they just want a kind of idea of your work experience and training. That's pretty much it. So there's not much to add on that. On the website, the BABCP website, it has you write it in an essay format, which I did, but then my supervisor at university wanted me to put it on a table. So yeah, I don't know what that's
Just
about.
going back to 13, Jason, sorry. Helen put in there, show your curiosity and give examples of when you've been creative in practice, giving that narrative. So yeah, I guess that's kind of being receptive to individuals' needs as well, isn't it? And kind of adapting practice to be flexible as well. An example, I was trying to think of one off the top of my head.
Well, I've got the example here about being curious with my clients. So I mentioned as my illustration that I was working with a person who mentioned anxiety was their main difficulty. And so that was kind of what I was expecting. When I looked at the 5 areas model, you know, actually what seemed to be the case was that it was more around rumination. They're less distinctive at step 3, but in step 2, worries and ruminations are quite distinctive. Worries are typically looked as more future-led. Rumination is more current and past. That's how it was. That's how UCL made the distinction at the time. So that's what I based it on. And I mentioned how I explored that a bit more, got a bit of a history about how she ruminates and how I brought that to supervision, and I showed a recording of the session, and I, you know, made a plan. So that's another way of me demonstrating my curiosity.
Yeah, I think my examples are a little bit different because I worked in a private practice with children. So I think that provides such a more broader space to be flexible. So I would do things like tie balloons with water and goalposts, and for everyone I popped, you know, I'd get somebody to give me a hot thought, or, you know, and I don't think you can have that level of creativity in IAPT, but if you've done it before and, you know, you've really changed your practice to meet someone's needs, get it in there, you know. Show your innovation. What did you do to overcome a problem? So, for example, worked with a young man with ASD, and he would get upset that everybody would eat his ice cream in the freezer. So the easy solution to that was to label everybody's ice cream in the freezer, so that threat disappeared for him, and he knew clearly what was his. You know, it's that curiosity beneath the problem, and how can we problem solve to overcome it in a creative way.
Yeah, and then just going to 1. So this is where, again, I was saying it's really important to check the evidence, because as you can see here, they want a self-statement, which is pretty much what we've been talking about, what to write, but there are other things as well. Now, if you're fortunate enough to have this, then that's all you need. If, however, you don't, then you need to rely more on these. So a reference, again, I believe that's counter signature. I never used references for the first one. Helen's nodding yes. So yeah, so reference is counter signature. If you don't have this, and you want self-directed study, so there's another template for that where you just kind of put the books you read and what you learned from that, and you just want to add that in your self-statement, saying, I don't have much kind of practice in this, but I've been reading about this, and this is what I've learned from reading this, yada yada yada. If you've got an undergraduate in psychology, then you would have done a module on developmental psychology. So immediately this counts. And that's what I relied on. So I relied on my BSc in psychology to demonstrate that. And I just, again, expressed some of the things I learned. So Freud, the 5 stages of psychosexual development theory, Jung's personality archetypes, Erikson's psychosocial development theory. These are the things I looked at when I was writing my life stages and development. And then again, they are going to want illustrations. So you just want, for me, I focused on the different client groups I worked with. So older adults, young people, the issues around those age groups, how I adapted to that. And I mentioned Maslow's hierarchy of needs, but I can't remember why. Oh, okay. So I referenced Maslow's hierarchy of needs. So if people don't know what that is, it's just a very simple model that kind of demonstrates the different categories of needs individuals have, being that we need to meet the bottom one first before we can start going up the ladder. And if anyone's worked with children and adult and parents who are vulnerable, you would know that it's very difficult to manage the symptoms of depression in a therapeutic setting if they don't have food, for example. So that need would need to be met first before they could really focus on, you know, their mental health. Those were some of the examples I gave. Ella, you got anything?
No, I think the same as you, kind of relied quite heavily on my undergrad, but also again kind of trauma work here. If anybody's worked in any trauma services, attachment styles, I put a lot about in that. Yeah. And I also put a lot in here about my own personal experience. So things around kind of my mom working in a psychiatric ward, my father looking after children with ASD, and family members, you know, who have ASD and learning disabilities, and how that kind of socialized me to, you know, understand about them from a young age. So I think personal experience can be quite valuable here, but again, I'd just be cautious of self-disclosure and kind of getting the right balance with that.
Another more easy one I use, and again, anyone who worked as a PWP and IAPT, pretty much anyone you work with, their childhood experiences will come into play. A very easy example to use is social anxiety. There's usually something from their childhood that has led to them experiencing social anxiety, bullying, overprotective parent, those sort of things. So that was how I used that. So the example I gave was working with a young man in his early 20s. He reported issues around anxiety. We explored that further. It seemed to be more in a social setting. I just asked if there was anything he experienced in his life that might have contributed to that. He mentioned that he had an overprotective mother, prevented him from doing anything with his peers, and felt that being overparented is what led to him feeling a lack of confidence in himself. So that was another illustration I gave. Anything around that before we go on, Ella?
No, I think a lot of people are saying as a BSc, okay, like alone, okay. I only had that prior to application. You obviously, you had your PWP.
Oh, I used PWP, but BSc would have been enough.
Yeah, we also did some online courses as well, didn't we, Jason? They weren't particularly expensive, but they just boosted our knowledge. But I guess we'll cover those a little bit more when we talk about theories.
Yeah, for me, that comes in number 4, which I think is the big one.
Yeah.
I'm not going to go on this one too much because, again, if you worked in a health and social care setting, then you would be aware of legislation to some degree. Again, you're not expected to know it off by heart, but it's about knowing the awareness. You know about the Mental Health Act, the Mental Capacity Act, you know about NICE guidelines. Just talk about your knowledge of them, search it up, explain some of those key legislations, give some illustrations of how you've relied on them. So that one, again, there's not much to add because pretty much anyone would have hopefully relied on those at some point or be aware of them. The other thing I used in terms of training was my in-house training on safeguarding adults, safeguarding children's level 1.
Definitely.
Health, safety and welfare, data security awareness. Those were some of the training courses I mentioned as evidence, and that was accepted as well. So again, pretty much anywhere you work would have in-house training like that. So 3, so we're talking about psychopathology, diagnostic skills. As a PWP, you're not diagnosing IAPT as a diagnostic service, but you are inferring mental health disorders and putting people forward towards predetermined therapy programs in a way, aren't you? When you highlight someone's got depression, they're going to have BA, maybe CR, for example. So as a PWP, there's a lot to work with here. As under PWP training, they teach you they give you a lecture on the DSM-5. You're expected to utilize the PHQ-9, GAD-7, even the additional anxiety disorder specific measures in order to get an idea of what the person's main problem is. So there's a lot to work with there as a PWP. Ella, how did you go about it?
I'm just minimizing the chat. This one. So I used a number of questionnaires. Obviously, working in a private practice, we used like Beck Youth Inventories, the NAS-Pianga scale, you know, just loads of different tools really that weren't diagnostic, but did point towards kind of some area of concern. So, you know, the Connors ADHD scale, and just kind of put in there kind of my knowledge of these, and then a time when I kind of used them to inform practice or a treatment plan.
Yeah, exactly. So same as me, if you're a PWP, you're guaranteed would have been doing this. You pretty much do this all the time. You're doing assessments. That's a big bulk of your work. That's going to come into it to a large degree. You're using measures. You're going to supervision. You're using the 5 areas. You're using a lot to make an idea. To have an idea.
Yeah, reference to the DSM-5 as well. You know, if you've got patients, again, not to diagnose, but just to say, actually, this patient has, you know, met this criteria, and I was aware of that. Therefore, this is why I picked that particular treatment path when I was working with them. Yeah,
exactly. So again, quite straightforward. And then here's the big one, and this is the last one. This is the worst one possible. If you're a PWP, you are outright going to have a harder time with this. And that's because as a PWP, this is the only one you meet, and you need to meet at least 4 of them. So very difficult, can require a bit of creativity. I was told by KCL that if you're a PWP with the long-term conditions training, then I believe you meet this one or this one. I can't remember. I didn't do the long-term conditions training, but if you did, then you would meet one of these. So with this one, so here's the thing about KCL and Royal Holloway that might sway people. They are so generous because they will offer you a 3-day course on the different models of therapy: systemic and family, humanistic, person-centered, and psychodynamic. It's an entire day split into 3 days, focused on each model, and you are given a certificate that counts as the evidence to meet it. And as far as I know, Helen, you've got experience in this. It's KCL and Royal Holloway, the only ones I know that do this. Yep.
Can you hear me?
Yeah, I can hear you now.
Oh, good. Yes, more and more courses now are offering kind of workshops. I know Sheffield are really good. Sheffield, in fact, Sheffield produce an alternative kind of manual, if you like. It's not a full manual, but they do go a little bit beyond the BABCP guidelines. And number 4, I would say in particular, because you can download this off, you can just Google it, Sheffield KSA guidelines or something.
Oh yeah, I remember
number
that.
4, it is split up in it explains what the requirements are in quite a nice way.
Yeah, thank you. So with this one, it was required being creative, and I was fortunate enough that someone I knew had told me about some online courses that were accepted. So,
there was a question about this, Jason, and we completed these online courses, didn't we? I can't explicitly remember the websites, but
I can find it. But I did a CPD in psychotherapy and counselling diploma, and it didn't take me 70 hours, but it was equivalent to 70 hours, and so it said. But because I was familiar with psychotherapy and counselling from the grad, I was able to kind of fly through it. I also did a 2-hour one on family and relationship counselling. So those were some of the online courses I did, and I don't know if KCL would have accepted it because they obviously I added the training they offered, but I can tell you Surrey did accept it, and they were happy with number 4 for me as well. The website, Ella, if you want to just entertain while I try and find it.
Helen, were you going to say something? Your mic's off.
What, me?
Yeah.
I was going to say psychopathology. Don't skip over it. It's one of the worst ones to pass. Everybody does a lousy job of it first time, or most people do. It really is. What is it? What does it mean? What are the different models? What's your understanding? When somebody comes through the door, how do you know how do you make sense of that person's distress? give it some thought, everyone, please. And it will be a fascinating thing to do anyway. Why do we do what we do? What's behind that? It's your knowledge. Where does that come from? And be critical of it. There's more than the medical model to understand mental distress, you know, so think about that. And yeah, 3 and 4 are the ones that the BABCP, they're the ones that probably mostly fail first time.
Yeah.
I can say that because as ex-course director, when we had our reaccreditation meeting and the BABCP came, I'm a strict marker, believe me, but they looked at a couple of examples of KSAs that I'd marked, and 3 and 4, they told us to recall everybody's from that cohort. So they could look at all 3 and 4s because they thought that I hadn't been strict enough marking it. So it's just to be aware of that, everyone.
Yeah.
I guess there are a couple of ways to do this, isn't there? Through courses or self-directed study. But for me, I definitely found courses the easier option, just because I found it more engaging. For me, that met my learning style. I mean, if you're keen for it, you can get the books out and really evidence that understanding, like what Helen's saying, you know, they're around kind of evidencing more than just kind of one model to mental disorders or distress.
Absolutely. And one of the things is it is about being creative as well, because even as a PWP, even though you rely a lot on this, you're using motivational interviewing. What is motivational interviewing? Well, what are some of the tools you learn? SMART goals, for example, is an MI tool. So in that sense, you can use that to kind of think about the humanistic, person-centered. How do you use SMART goals? Well, I use it to kind of make sure that, you know, what we're doing is meaningful. For example, systemic and family. If you work with children, you can't work with children without the parents getting involved to some degree. So it is, for me, it really was trying to squeeze any little bit out I could to try and add to my experience with this, the tiniest little thing I could think of, just to help bolster it. I went with the KSAs as a whole, I went with the process of write too much rather than write too little. So I could at least touch upon things. My number 4, I'm just looking at it now, is 8 pages. My KSA 4. I don't know if, Helen, that's the standard, but that's how long mine was.
That's probably, you know, quite long, but, you know, it doesn't state any limits, but it's better to be probably a little bit longer than, you know, just like 1 page, because clearly you can't include all of that information in such a small space. But 8 is quite long, yeah, but I'd like to read that sometime.
And for me, I've got to break it down each 4. So what I wrote about was biological, humanistic, person-centered, psychodynamic, and of course, I'd be mad not to do CBT as a PWP. And I broke it down further into my knowledge of the model, and I had that as its own separate heading. So this is my knowledge. These are the theories I know. This is how I've learned it. Yada yada yada. And then I broke. The next part was application. How have I used the model in my practice? And this is where I really had to squeeze for things. So SMART goals, for example, motivational interviewing, working in drugs and alcohol, you rely heavily on MI, for example, active listening, Carl's Rogers, all these things. I was just throwing any bit I could to get into that. And again, you want to provide illustrations of these. So CBT, if you're a PWP, then you will meet this. However, be forewarned that they are going to expect a hell of a lot of information from you on this. If you're a PWP, KCL did anyway. Again, it may vary uni to uni, but I was told by Suzanne that they want this to be very robust if you're a PWP, because they know this has been the core of your work for 3 years as well. In terms of the courses, so I can't find the exact link, but so it was through Read. Read.co.uk, and I'm just trying to find it. Now I got the training quite cheap. I think it cost me £20 and for 70 hours. And when I told Suzanne about it, her response was wow. So I think that was well enough for the training. If you type Read online training, you can. So I'll just show you here. I'm just going to stop sharing and share this. So this is the website. If you just go on read.co.uk courses, and I don't know, just type counselling, for example, there's quite a few courses to go on. And this is what I was told. So look, apparently this is 400 hours, and it's like, that's insane. And it's only £10, down from 1,100. It ends tomorrow, guys. Buy it while you can. So this was
and those are the courses me and Jason did use for our KSA. I think I spent about £100 all in all. I didn't get them as cheap as Jason, but you know, they do have some good offers on.
Yeah, this is great. Mine was 70 hours and I got a wow. So imagine with 400. You know, would you be impressed with that, Helen?
Yeah. I was going to say Shirley Reynolds' site. She does loads of online CPD, and most of it's free, I think. In fact, I think it all is. I don't know how detailed it is, but she's excellent. So
if only we knew that a year ago.
She's phenomenal. So yeah, that's
Shirley?
worth knowing.
Who's it? Shirley who?
Shirley Reynolds. She's you know, associated with the Charlie Waller Institute at Reading.
Okay, and what, she does CPD training?
Yes, I mean she's a, you know, she's
there you go. It really does exist. I like that. It answered my first question. Does it really exist? Yeah. Okay. So there you go. Free. So you know, you could go on here as well. So there's a nice bit of information there as well. So I'd recommend just typing that. And
Helen, we had a question saying, do these courses have to be accredited? I can't remember when I did mine, if they were accredited or not, or is it just that they include substantial CPD hours?
Yes, there's no, obviously you want something credible, don't you? But in terms of accredited, I mean, you get so many different kind of organizations who are offering training, and it's hard to know. Obviously, you want to go for credible. So anything like that is offered by the BABCP, because they often have some freebies, not many, but since we've been in the pandemic, they have been offering, you know, some free things, but some of those aren't very substantial. But and the Oxford University or Oxford Cognitive Therapy Centre, they're really credible and they're just great to go on. You want to do training that you're interested in. Don't just tick box. Do it because you really want to learn about it, and it's worth paying if you're going to really enjoy it. You know, don't see it just as a, like I say, a tick box. And everything you learn will have some value to you.
And it makes you do a better job. I remember going on integrative and systemic family training, and I really do value what you say there, Helen, because I did that in my role as an assistant psychologist, and I kind of did it in preparation for this application. That was the initial motivation. But then actually when I was working with a young boy and his mum alongside a clinical psychologist, my practice just come to life because I was able to kind of really relate that back to the training and understand actually why I'd done what I'd done. So yeah, you know, it is brilliant, like, to attend them, to enjoy them, and then to take those skills away in your current roles whilst you're kind of going through the application process.
Definitely. Remember, this is your badge of honor, this portfolio. If you don't have a core profession, that's you in that book, and that's something to be proud of. So treat it like that, not that it should be something that you fear, or, you know, of course it's a big piece of work, but it's all about you, and who doesn't like to have a big document that's all about you and celebrate it.
KSA has been really helpful because it's something that sticks out to you because you are pretty much consolidating all your experiences.
Yeah, exactly.
And it's really helpful to read that out and just reflect on that and really remember that. And, you know, even though you'll be training as a CBT therapist and that's the model you'll be using, no single therapist relies on only one model. They will use bits of everything somehow. So, you know, looking at my knowledge, obviously humanistic, person-centered, you know, I referenced my undergrad. Unfortunately, I got different messages from this. Surrey told me that for the biological module, your undergraduate would suffice. But other courses have told me differently. So check with the course, Helen.
Well, I wouldn't even go that far. I think that's getting a bit too into the minutiae. Remember, yes, there are guidelines, but within the guidelines, we're talking about your individual knowledge. So just because, you know, 6 people out of 10 have have mentioned X, Y, and Z. If that's not your knowledge or your understanding of that particular model, then it has to match your own experience and your own reading and your own courses, if that makes sense. So I personally wouldn't say that there has to be a standard set of courses where you get that knowledge, and all of those knowledge criteria don't say that. They say that you can get it from guided study, or you can get it from courses. So that sounds a little bit like rigid, but of course
I think sorry did give the impression of being more rigid, but they accepted mine and they said biological was fine. But looking at here, humanistic, obviously when you're writing about humanistic, you've got the key names here that you want to think about, key theories, key models, and just kind of writing a bit about the history. That's what I did. So I talked about the history. This is why my whole KSA 4 was so freaking long, because I wrote everything.
And really draw out from your experience here as well, like Maslow's hierarchy of needs. So I worked in homeless services when I was first setting out on my compassionate journey to help others, and I really just brought that into it, not just kind of your clinical roles, but what did you do before, anywhere where you've kind of been a support worker. Where did kind of the underpinning of this knowledge come from, or where did your kind of interest or excitement in that theory or way to work come from? What made you want to go and learn more about it?
Yeah. Absolutely. You see, that's coming to life now. It's not just is it? It's you explaining what you've learned and why you found it useful or not. Be critical in there.
Absolutely. And just be really creative as well. So like I said, squeeze as much as you can, because look, combi, that's something a lot of people might use. If you're a PWP, you'll be familiar with combi. Confidence rulers, things like that, all really beneficial to add in there as well. So it's doable. It is just being a bit creative with it as well. There's some that are endorsed by ABC awards. Oh, that's about the CPD. Yeah. So that's pretty much the KSAs in a nutshell. It's really important to remember, like Helen said, there's no strict rules for what they're looking for. KCL made it very clear they emphasize certain KSAs over others. And for example, they said to us when it came to the second one, I believe, was it the second one? I just got to remember. So yeah, KSA 2, they pretty much said, if you don't add any of your certificates or anything, that's fine, because we'll just know from your experience that you will have met that. They did not care about evidence in the same way. But then they emphasized they care a lot about, they might care more about another one over other universities. So
care about it all, then you're covered.
So that's my point. Care about it all, treat it all equally, but just know there's no formula to this. And that they'll be looking at different things. And it's really your opportunity to sell yourself and really show the kind of person you are and what you want to be. And there's a reason why some of the courses do ask for the KSAs before the interview as well. Not all of them, but like I said, Surrey, they wanted all of them done before the interview. So if you are applying for Surrey, just bear that in mind as well.
Well, you imagine, it takes a long time to write. They take a long time to mark as well. And if you're recruiting and you've got 30 people coming on, and half of those have got KSAs, it does take a hell of a lot. So if you've got a fantastic KSA, the course director is going to love you. It could be a deal breaker, really, if you've got a flimsy KSA, and even if you've interviewed really well, it's really a hard position for the course to be in if you haven't got that document ready.
Absolutely, and they will care about that. Hertfordshire, for example, didn't ask for a KSA. I referenced in my interview that I'd done it. They were quite impressed with that, because they cared, because it's showing what kind of applicant you are, that you're eager, you're on top of things as well. Got a question from Kate. This is great, thanks. You're welcome. Is there a place to find out different application? So really, Kate, I'd say jobs are pretty much going to be on NHS jobs. If you look there, you'll find them all. It's only King's that'll be through their website, as far as I know.
And yeah, just to be mindful that some universities you have to apply both directly to the university and the job. So Birmingham, the Midlands, Stafford, Coventry, Warwick. So you'd have to apply on NHS jobs and go through one application process for the placement and then another one for the university.
Oh, that's true. So someone asked earlier about something like that, and I kind of said, no, you apply through the job and through the uni, but actually Birmingham's an example of when you apply separately. The reason I had that mixed up is because Birmingham had a little different thing that year where they had the opportunity for you to interview for both the university and the service at the same time, which is what I did. So I never ended up applying to a service separately. So that's why I had that muddled up.
Are all the services based in, is all the places based in IAPT? From my knowledge, the funded ones aren't they? So, perinatal services, actually, that's a lie. I've got perinatal also, on mine.
If you work in the SLAM service, so that's Lewisham, that's Croydon, that's Lambeth, and probably another one I can't remember. Then you do a 6-month placement in IAPT, and then you do a 6-month placement in the Maudsley service, CADAT, which is the Centre for Anxiety Disorders and Trauma. That is a national service, so you work with a lot more complex disorders like hoarding, for example, and that. So that's a good opportunity. And Southwark, thank you for that. Yeah, so Southwark's the missing one as well. So yeah, if you do apply and you're in a SLAM service with KCL, you have the opportunity to do 6 months IAC, 6 months CADAT, which sounds fantastic. And I wish someone told me that before.
There were another couple of questions, Jason, around do you need to contact each trust or course individually? Everywhere is so different, so I'd recommend going on to kind of each university or each trust for different information. Yeah.
The BABCP website has the list of all the courses.
Yeah.
Don't know.
And somebody, if you could post the link, Jason, somebody asked me specifically about my experience. So I started off volunteering in homeless services and then become an activities coordinator and support worker in homeless services. And then I went on to deliver CBT programs in custody to people that offended. And then what did I do after that? I did that for 3 years, and then I left to do a private practice assistant psychology, and that was so broad, like literally I can't even put a label on that. I worked with kind of children who were sexually offended to kind of individuals who had brain injury in their 80s. It was kind of that varied. So I was really, really lucky to have that role in that experience where I just learned so much. But in that role, I felt like kind of a jack of all trades, master of none. So that's kind of what really led me wanting to specialise. I had a kind of little mini meltdown when I didn't get onto the doctorate 6 years in a row. So I then jumped ship into probation for 6 months, and I started a professional qualification training to be a probation officer. I would always say from that experience, go with your gut, and even if kind of you're not kind of, I don't know, for me that was just a really bad time. You know, I wanted to progress and I couldn't see an avenue for that in psychology at the time, and I ended up somewhere which I really didn't enjoy. I think it's great to try things, but definitely stay true to who you are and don't let pressures kind of pigeonhole you into paths that isn't where your passion is. I think sometimes when you're not getting job roles and you're not successful in applications, that can happen. But for me, it was really important to come back to what I value and what I really enjoy, because that's where I'm most productive. And so yeah, after 6 months in probation, I was lucky enough to get this role. So yeah, not a traditional route, not from PWP or IAP background. And I would say Birmingham particularly value the diversity and that experience. I don't know of any other courses. What about you, Helen? What's your experience?
Well, we used to get quite a blend, really, and we value that. We like the diversity of backgrounds, and that's what I love about CBT, because there are so many different pathways to becoming a CBT therapist, and I think that's really something to celebrate. So that's why I particularly like the fact that we have got the KSA route currently. Who knows in the future? They're even tightening up with core professionals now, because previously if you had got a qualification, even if you hadn't practiced in that area for a number of years, that was fine. Now there's kind of being more strict with some of those core professional requirements that you have to keep up to date with your registration. For some nurses like myself, I won't be able to do that unless I teach on a nursing course to get those hours in. So, you know, there's a mixture, and we always used to get a mixture of people, and it was always very fascinating in the classroom on a trainee course to have some PWPs, some counsellors maybe, and some mental health nurses and OTs. And it's just lovely to see people going through that process and all, you know, having the same goal.
Yeah, and when you said about tightening, I was thinking, if I'm not successful, I'll stay at my probation qualification, become a qualified probation officer, and then just jump ship. But they've actually taken that profession off. Yeah, so you can't be a probation officer and jump over now. So yeah, that was quite gutting for me, and that was really what motivated me. You know,
just like Lauren said, we also missed out as well. Her master's was a core profession until 2020 October.
Oh, how gutting.
Yeah.
But at the same time, I say that, you know, I really actually, on reflection, enjoyed doing the KSA. And I really do relate to what Helen said earlier. It is really a badge of, you know, that pride and reflecting back on your own clinical practice. I think when I applied, I was in a place of very feeling disheartened, perhaps not good enough because of the continued rejection from the clinical psychology doctorate. And actually writing that document allowed me to reflect, you know, wow, I've actually got, well, at the point of completion, I started in homeless services when I was 16. So, you know, 14 years of experience working with vulnerable individuals, and just thinking about all those experiences and what I'd done was quite overwhelming. And it was just a bit like, wow, actually, I do deserve this. I am, you know, I am a good practitioner. And it just kind of allowed me to believe that in myself, which I think was really helpful for the application process and the interview process. And I actually think by doing a KSA, if you prepare it in advance to the interviews, you are in better place than people with a core profession, because you're going to be answering the stuff they're going to, like, you're going to have already considered what they're asking.
Absolutely. I was just about to say the same, that it's going to help you prepare for your interview in a way that few opportunities present itself. When I had my KSA written, I had all that knowledge at the forefront of my mind that I could draw on. And so it's a very useful thing. It will make you a better practitioner. Just divide it up. Don't look at it as one big project. Just focus on each KSA at a time. If you start now and you aim to do 1 or 2 a month, you're on good track to get it done by the time you need to for the September, October intake. This is around the time I started. I pretty much had everything done. I just needed to speed up towards the last month where I had to do 2 in 1 month. But if you start now, you make really good progress as well to get it. And so just aim to do 1 a month as well. I was going to say, in general, you know, the reality is, I mean, who here is a PWP, by the way, just out of interest? Because people just raise their hand or, you know, do a little reaction. I'm just curious. Yeah, so quite a few. I'm going to be honest with you guys, and this is something I have to be honest, and it's going to be big-headed. You're going to be fine getting interviews. I applied for 12. I was offered 12 interviews. I only went to 6. I was offered 4 places. My experience is PWPs will offer you what you need to get it. That's going to be big-headed, but that's just my experience with it. So that's one of the things with the PWP.
Jason, there was a question from Olivia saying, does it all have to be psychology related experience on the KSA, or can you include roles outside of that? So I definitely drew, you know, although I didn't enjoy it, I learned a lot within my probation role, and I reflected a lot on that on my application. I also drew upon being a support worker. I've got colleagues that have worked in social work and teaching, and they were areas they really strongly drew upon in their KSA. What do you think, Jason and Helen? I think that experience is valued.
You've got to showcase what you've got, haven't you? And don't be shy about it. They're skills and experience that you've got, and obviously if they're relevant, it's you showing that in those criteria, isn't it, in those statements.
I think there's like some areas where it's more strict, like you really do need the clinical stuff for the attitudes for your references on the KSA. So if you've never had clinical supervision, I think, you know, you would struggle.
So someone saying,
you know that you meet the criteria before you know, kind of write it. And if you do find that you come unstuck, then, you know, make sure you go away and sort of like get the necessary bits to, you know, plug those gaps, because you really want to be in a position to know, I meet the criteria, I've just got to show it. And if that's the case, then if there's some additional things that you've got to put in there, then that's just a bonus, isn't it?
Yeah. And just to